Good morning, everyone. Can I get your attention, please? Good morning. How's everyone doing? I hope you got some breakfast. You were able to mingle a little bit. Could you imagine living in a world for years with no access? Basic necessities were not within an arm's reach while roaming the same community that seems to bypass you every week, feeling unheard and unseen, tugging at your pride and dignity, banking your life at the chance of just one possibility, not a hand up, but a heart out. A simple piece of non-judgmental humanity, not overlooked as if you were just another part of the street while surviving a pandemic encamped in the middle of a public health emergency. Nowhere to safely isolate or quarantine. Quality of life already labeled low expectancy, but still praying for some type of assistance that should already come naturally. See, this is why the coalition and the homeless response system exist, coordinating efforts to reach the lives whose life experience hit them unexpectedly. Now, we've all heard the saying that we are all one check away, and COVID-19 has made it no better, except better understanding that circumstance does not necessarily define character. A frame of mind we can change in an instant if we all choose to work together collectively. Access to housing, healthcare, supportive services, and equity, breaking down barriers that's built to set them apart from the rest of society. See, that is unacceptable. So we will continue to advocate at the points of every level until every unsheltered individual has stability and a place to settle. See, these are historical times, and this is just the beginning. So until each person has access to basic humane living and a place to call their own, why don't you join us in our efforts as we guide them towards the way home? Thank you. Yes, this is how we are kicking off the State of Homelessness Conference 2022. My name is Ashlie Young. I am the manager of landlord engagement with Coalition for the Homeless, and I will be your MC for today. So just for a second, the reason I wrote that poem obviously was just to show respect for anyone and everyone who's experiencing homelessness. I've been telling my colleagues for probably the past 2 weeks, I'm so excited about the State of Homelessness conference. And reason being is because I get to be in a room filled with people with the same passion for compassion. I'm excited because I get to be in a room with the funders and sponsors and advocates from the legislative level all the way down to direct client services. It matters. And so I'm also excited because I wake up each and every morning believing that we're going to end homelessness, and I'm surrounded by so many people in the same room who wish for the same thing. So, again, welcome to our State of Homelessness 2022. Thank you all so much for being with us. We are looking forward to a great program today, especially hearing from Jeff Olivet, the Executive Director of the U.S. Interagency Council on Homelessness, who came to town from DC to be our keynote speaker. While here, Jeff has also been able to learn more about our work to end homelessness by visiting with people with lived experience and key partners in our work. With him is Tamara Wright, Regional Coordinator for the U.S. Interagency Council on Homelessness. So if you could please give a little wave. So here we go. Thank you. Thank you so much. We're so glad that both of you are here with us today. But to get us started, please welcome to the stage from our own board of directors, Lance Gilliam and Troi Taylor.
I've never had a problem speaking loudly. I know you haven't either, Troi. Thank you, Ashlie. That was amazing. And I'm already off script. It's a reminder of why we do what we do. And as we sit in boardrooms, sometimes we become detached from the actual work, and our staff never lets that happen. And it's important to us. So thank you for the beautiful poem. I'm Lance Gilliam. I'm proud to be the chairman of the board of the Coalition for the Homeless Houston-Harris County as we celebrate our 40th anniversary year.
I'm Troi Taylor, and I'm also proud to be to serve on the board of the Homeless Coalition. Actually, I'll just tell you, if I could only change something different, I probably would have went first just because that was so powerful. But that almost seemed unfair. No, but we're glad to be here, and we're really glad to be here in person after doing events like this socially. This is just a great refresher. We extend our warmest thanks for being here for those that are online, and we also encourage you to participate via the chat, via Zoom. And now we want to recognize the sponsors that help make this happen. Our gold sponsor, Court. Two silver sponsors, the Ballack family and Zillow. Bronze sponsors, Group 1 Automotive, Houston Methodist, and the Life Startup Essentials. And our final sponsor was Amity Bank.
Thank you. We know that some of our guests will be joining us later in the conference, but if any of our elected officials, I haven't seen one, are here now, if you'd please stand so we can recognize you. Anyway, thank you, our elected officials. We'll have them join later. Thank you for being here and for your work to end homelessness in our community. We also want to recognize especially Houston's Mayor Sylvester Turner, our county judge, Lena Hidalgo, and especially one of our county commissioners, County Commissioner Precinct 2, Adrian Garcia. They weren't able to be here today, but their leadership has been incredibly invaluable, especially for the community COVID housing program, which we'll hear about later.
So what do we do here? The Coalition for the Homeless acts as a catalyst, uniting partners and maximizing resources to move people experiencing homelessness into permanent housing with supportive services, but we don't do it alone. The Coalition is the lead agency to The Way Home, the collective effort to prevent and end homelessness in Houston and throughout Harris, Fort Bend, and Montgomery counties in Texas. And it's made up of more than 100 partners, all from the community, many of whom are present here today. I'd like to take a moment to recognize them and the steering committee for The Way Home. So if you work for a nonprofit service provider or a government entity, and you're here today, please stand now.
We know y'all are here.
Thank you. No, thank you. It's your commitment to this work day in and day out that brings us closer to making homelessness rare, brief, and non-recurring.
Thank you. So collaboration is the theme of the day. In fact, it's the underlying value in our success of the coalition. It's only by working together that we've managed to become one of the most effective homeless response systems in the country. Over the past decade, together, we've ended homelessness for more than 25,000 people by placing them in permanent housing with supportive services. No one organization acting alone could achieve this, but when we work together, we make the impossible possible. This is the great part in our script that we've been given. Both Troi are given 1 or 2 minutes, only 1 or 2 minutes to say what we want to say. And I'd like to say two things. One, I want to speak to our board. we have been blessed with an incredible board. And that board was built intentionally. It was built with leaders like Troi, who serve on other boards at Metro, and throughout our partners, Search, New Hope Housing, Community Land Trust. I know I'm missing somebody here. Houston Housing, how could I forget the Port Authority, and especially the Houston Housing Authority. But those leaders who are in the room with us, they're in the room with others in our community, have lived experience. They're in the room with us who have mental health expertise and other qualities that can, together, we as a board collaborate towards a common goal. But when we have an issue, and this goes to the second thing I wanted to speak to, is we figure it out amongst ourselves. It's never occurred to us not to be successful, and we're thankful to our staff for that success. But as a quality and a value, we get up every day with the mission of just get it done. And if we don't get it done that day, we get back up the next day and we try again. That failure the prior day is the value that drives us the next day. A failure is just a lesson learned and a lesson not to be repeated. So I want to thank all of our board members for all your service, the staff that supports us, that lets us celebrate our success. We know that y'all do the hard work, but we love to talk about it and we're very proud of it. Troi.
Thank you, Lance. I'll try to make this brief and we'll see how I do. My daughter asked me this morning, she said, you're going to one board meeting and then you're headed to another board meeting. She says, so what does this one do? And we've always had a heart towards the homeless, but growing up, I always thought I knew exactly what it looked like. I thought it was the person in front of the convenience store or the grocery store that was asking for money. And I thought it was the person at the stop sign or the red light or under the highway that had a tent. That was homelessness. That's what it was. And that's what I responded to. And then I was convicted as I gotten older and realized that one of my high school colleagues who I admired and literally wanted to be like, just a noted and gifted individual that ended up playing for the Green Bay Packers and ended up being their all-time leading receiver. He's from Houston and just a great individual, Donald Driver. We found out that he lived in the back of a U-Haul when we were at school, and I admired Donald Driver. So you don't know what it looks like. And then in college, I had fraternity brothers and classmates that would often say, can I crash on your couch? And I'm like, go home. Go home. You're just being lazy and not realize that you could be in college and planning for a future and still be homeless. So it takes a face. And I think, Ashlie, you said it well. They want to be seen, they want to be heard, and they want to be valued. And I think that's what this group is doing here today. So we thank you for being here.
Thank you so much for sharing that, Lance and Troi. We really appreciate you and everything that you have done to serve. It's now my pleasure to introduce Houston City Council member Tiffany Thomas of District F, Chair of the Housing and Community Affairs Committee for the city. In early 2020, in response to the COVID-19 eviction crisis, Councilwoman Thomas, alongside Mayor Sylvester Turner, initiated a rent relief program that has since gained the attention of the U.S. Treasury Department as a national model. Councilwoman Thomas remains vocal about the importance of preserving affordable housing options for all Houstonians, including working families and those experiencing homelessness. We are so glad she is able to join us today on behalf of the city. So please, everyone, welcome Councilwoman Thomas.
Clearly my squat workouts are working. I wasn't expecting not to have any stairs. Thank you. I'm gonna go ahead and put this here. I'll talk with my hand. So I know y'all were expecting to see Mayor Sylvester Turner, but you are here with me this morning. So we're just, and I'm here with you. So I appreciate that. So before I go into remarks and bring greetings on behalf of our mayor, it is important that I acknowledge local leadership that's doing this work quietly within the city. Melody Barr, her work around public services, her and her team are leading, making sure that the contracts we issue, the notices of funding availability, and making sure that agencies are meeting the priorities of the city and our metrics. I want to thank you for that. Also, Marc Eichenbaum, if you're in this room and you don't know who Marc is, I wonder why you're in this room. So Marc has a two-person shop. Is it one person in the shadow? So Marc has one person in the shadow in that office advising the mayor and council on priorities around homelessness in our work. And I want to publicly acknowledge him, and also our newly minted director, Keith Bynum, that represents our housing department and his leadership. So thank you for that. So clearly it's been a wonderful, or maybe not so wonderful, last 2 years. We have been separate so we can be put together today. And so it's good to see all y'all in the flesh in 3D. So on behalf of Mayor Turner and the city, I want to bring you greetings. He's currently in DC representing our city as he chairs the African American Mayors Association. So hopefully he comes back with some big wins. I know there's some significant conversations he's been having. So it's my pleasure to welcome all of you to the very first State of Homelessness event, which is remarkable. And it's crazy that this is the first ever State of Homelessness in our region. And so I want to acknowledge the coalition for coordinating all of this, and for each of you that have taken the time to do a couple of things. One, traverse through Houston's traffic. I don't know about y'all, but I don't know where all these people came from after 2020. Go home. But that's number one, but then also making sure that this was a priority and on your calendar to attend. And for those who are joining us virtually, we want to thank you for joining us in the Zoom room. So regardless if you work for an interagency or a nonprofit, if you're a philanthropic partner, or if you are just Jane Houston interested in making sure our unhoused neighbors have a place to stay, the work and your attendance today is critical to our city's mission. What makes us so special is that our homeless response system, the Way Home, it's not owned by Mayor Turner. It's not owned by our county judge. It's not owned by the coalition. It's owned by each and every one of us and all of our partners throughout the region, something collectively. And as Ashlie said, she says, we get to do this work, right? We get to do this work together in our region. And I'm glad about it. One of the reasons why we are a united response system is because we get to combine and leverage our strengths to collectively drive transformative impact, which is really important. We're not just talking about it, we are being about it, and then we can quote the numbers and the impact with our work as well. We are also very aware that we must acknowledge that homelessness is a community issue. And because of that acknowledgement, we have created a community-wide response that we are all stewards of, from the resident in the neighborhood that calls 311, that acknowledges a encampment growing under the Beltway, to the coalition, to search, to everyone that participates in our homeless census count. All of us are stewards of that work. And while we may only have a shred of funding that other cities may have, what we do have is each other, which is demonstrated in our amazing results. Now, I would be remiss if I didn't talk about the limited resources and lack of funding and how the pandemic absolutely threatened the progress in our great region. But in Houston, we don't just shrug our shoulders at adversity and survive. In Houston, we believe it's our time to thrive. We believe in turning crises into opportunities, and we have demonstrated that over the last 14 months. One of the other things that I'm really proud about, just as a council member witnessing the work that you get to do in the community, is that the city and the county teamed up to invest $65 million of federal COVID-related funding to launch the Community COVID-19 Homeless Housing Program. This is the largest and most ambitious initiative to reduce homelessness in the history of the city. I think we can pause and acknowledge that work. So through the hard work of all of you here and those that are joining us virtually, the program housed more than 7,000 individuals experiencing homelessness in 14 months. Now, if we were at the Black church, that would be the praise break. If we was at church, that would be the praise break. Because I want you to understand the impact of that in 14 months while navigating a pandemic. unknowns, fear. We were able to house 7,000 people that otherwise would still be in an encampment, otherwise would still be in a car. Also responding to the rent relief issue of those experiencing impacted by COVID, losing their jobs, now being faced and met with homelessness. This is the work that you all did. This is the work that we did together. In addition to that, because of the 14 months, you reduced homelessness by 20% during the pandemic. Many cities, that's a praise break, all right. Many cities can't tote those numbers, which equates to a 64% reduction in homelessness since 2011. You're doing remarkable work, and it's important that we stop and pause and acknowledge the successes, because many of you have been doing this with your head down. Many of you have been doing this navigating your own personal crises, your own dealing impacts with COVID, your own challenges, and you've been getting up every day making sure that some of our least and lost had an opportunity to make their way home. So if Mayor Turner was here, you would hear him say, and he does this often, in Houston, we go big or we go home. And we are going big, so the most vulnerable around us can go home. That's why the city recently launched the Way Home, a $100 million continuation of the program, with the goal of housing an additional 7,000 individuals in the next couple of years. So all of this is important, and to pull this off, we must look in the proverbial mirror and we must ask ourselves some questions about how we're going to do that. I know Ashlie standing up, she's telling me that it's almost time for me to sit down. But I'm gonna leave you with 3 points, and 3 points that I want you to sit with and think through as you experience this day together. So as we look in the mirror, we must remind ourselves that we cannot be complacent. It's important for us to acknowledge our successes, but we must continue to keep our eyes on the prize. And as the young kids say, foot's on the gas. That's in one of the 3 points that I want you to sit with and think through as you experience this day together. So as we look in the mirror, we must remind ourselves that we cannot be complacent. It's important for us to acknowledge our successes, but we must continue to keep our eyes on the prize. And as the young kids say, foot's on the gas. That's secondly, in order to achieve those big goals, and after responding to a series after series after series of crises, many of us are exhausted. And anyone doing work around public service, there's a collective exhaustion that we're all experiencing, and that is natural. That is our human nature. But I want to encourage you to continue to keep on going. We are running a marathon with a series of mini sprints, and each of us need to remind ourselves that there are Houstonians that are depending on us. There are Houstonians that without us answering the call, responding to the email, completing that paperwork, they would not have that opportunity. And so for individuals that are performing at high levels for a sustained period of time, it is difficult, but we have no other option, coupled with the economic impacts of the pandemic, followed by the attack of affordable housing currently happening in our market, continuing to widening the gap and keep others out of making sure they have access to attainable and affordable housing, costing less than 30% of their income. So lastly, I must leave you with this. We must resist the temptation to adopt politically based theories masquerading as solutions, and recommit ourselves to data-proven solutions for housing. I'm gonna stop and repeat that one more time, because that's what's really important. We must resist the temptation to adopt politically based theories masquerading as solutions. It's easy to have the Twitter talking point. It's easy to post something and share something on Facebook, but we must center ourselves around data-driven solutions, which we have done, and we have those results. And lastly, this is why today is so important, and it's a much needed opportunity for us to connect and reconnect, for us to learn from each other. And I want to just thank everyone for the work that you do. When you challenge the city to do more, that voice is important as well. When you challenge the county to do more, when you challenge your staffs to do more, it's important. And we're all working together for the good of those in this city. So I want to thank you on behalf of our mayor and wish you a well and wonderful event. Thank you.
Thank you so much, Councilwoman Thomas. That major thank you to the mayor's office, and thank you for your representation. That was amazing. And we get to continue to thrive because of your support as well. So we appreciate that. Crisis to opportunities. Yes. So our first session of the day will be on health and healthcare. We know that for people experiencing homelessness, housing is healthcare. Our next two speakers deliver healthcare in the traditional sense as well. Dr. Charlene Flash is the president and CEO of Avenue 360 Health and Wellness, an 8-site health system in Houston that provides cradle to grave care while addressing social determinants of health, such as housing instability, food insecurity, and racism. She is an infectious disease physician who holds faculty appointments at the University of Houston and at Baylor College of Medicine. Frances Isbell is the inaugural CEO of the Healthcare for the Homeless Houston, a federally qualified health center providing care for 8,500 people annually. She was instrumental in bringing together many community-based agencies, healthcare clinicians, educational institutions, and public organizations to forge a common strategic plan to effectively address the health needs of people experiencing homelessness. Will you please join me in welcoming Dr. Flash and Frances Isbell?
Here with the two of you there so we can hear you both.
And here's clickers. This.
Yeah, this little guy here, and she said down is forward.
Thank you.
Thank you, and I'm honored to be here with Dr. Flash. We go back just a little ways. One of the things that happened was when she took over Avenue 360, we had lunch plans on March the 15th, 2020. And so we didn't actually get to see each other in person for, I don't know, a year and a half later or whatever. So we're here to talk about health and health care within the homeless population. Down, down.
Why don't we just say, oh, did it work? Okay, good. It's a hard push.
Okay. Now our slides aren't up. Next. Okay, so one of the things that Dr. Flash and I wanted to do was kind of set the stage a little bit in terms of how does homelessness affect a person's health. So some of these statistics might be fairly shocking to you if you don't know a lot of this world. So the people who are experiencing homelessness have a mortality rate of between 3 and 6 times of people that are housed. The estimated lifespan is reduced by 13 to 32 years. Persons with serious mental illness die 29 years earlier. 54% report that homelessness was precipitated by a health crisis. Medical costs, many of you may have read the LA study that came out, I don't know, 12 years ago. That study indicates that medical costs account for 58 to 62% of the overall costs of someone who is homeless. They have 9 to 13 times more emergency department visits and 3 times more hospital days than people that are housed. Next slide. So I like the next 2 slides. Next slide, please. Because it gives you a really good visual, and I'm not sure how well I can see this. So the reddish are people that are in the general population, and good, I didn't think to bring that. And the kind of navy blue, I'm sorry, I've got it backwards. The navy blue are people that are in the general population, and the kind of wine color are people that are experiencing homelessness. I like it because it's a good visual. So you can see with high blood pressure, the difference between people who are housed and people who are not housed, the difference between diabetes, between housed and unhoused, hepatitis and HIV. You can hardly see the line in the general population. And then we've got this over 4% of the homeless population having HIV. So a much, much higher incidence. Next slide. And when we look at mental illness, then we begin to see an even greater disparity between people that are housed and people that are unhoused. Look at that depression. And of course, if one is experiencing homelessness, you would assume that there's going to be a very high prevalence of depression. But it's, to me, these slides are just startling when you look at the difference between people that are housed and people that are not housed. Next slide. Mental illness and physical illness is one of the leading causes of perpetuated homelessness, and that has been documented in study after study. Chronically homeless people, even within supportive housing, 73% have been diagnosed with chronic pain-related disorders. 64% have severe mental illness. 44% have hypertension. 24% hepatitis, 22% diabetes, and 81% substance abuse disorders. So again, just this great disparity between people that are housed and people that are not housed. Next slide. So I'm going to give just a brief overview of Healthcare for the Homeless Houston. Next slide. Our mission is to promote health, hope, and dignity for those affected by homelessness through accessible and comprehensive quality care. Next slide. So who do we serve? We serve people who are still literally on the streets, people in emergency shelters, which of course we have very few of anymore, people in temporary transitional housing, people that are temporarily doubled up. So we see people who are literally homeless, still on the streets. Our funding source, which is different than HUD, allows us to continue to see people in permanent supportive housing, because our funding source doesn't consider people that are in permanent supportive housing unhomeless. I don't think there's that word. I don't think that's a word actually, but so we get to continue to see people that are in permanent supportive housing. The fastest growing patient population are people that are over 60. So what's happening in the general population is also happening in the homeless population as well, which is terrifying when we think about the needs of people that are over 60 and the complexities of people that are over 60. And 90% of the people that we see have no form of insurance. Next slide. So we have 3 different locations. Many of you know the Caroline Street location, which is our standalone clinic. That's right by St. Joseph Hospital. We have the Cathedral Clinic, which is located within or adjacent to the Beacon. And then we opened last year, in the middle of a pandemic, we opened the Reed Family Clinic, which we're really excited about. That is located in the New Hope Reed location, and it serves families, including children. So that's really exciting. We're within 7 different permanent supportive housing sites. We provide street medicine, and also we provide the transportation project that many of you participate in, Project Access. Next slide. So our care model is an unusual care model that is becoming more and more common. We were the first agency here in Houston to implement what's called primary care integrated behavioral health. So what that means is that within the primary care setting, we have both psychiatrists and clinicians who only work within the clinic. So they work side by side with the primary care clinician. We do have longer term therapy and psychiatric services, but within the clinic, they are all located right there with the primary care clinician. And why do we do that? Because there's study after study that will indicate that if you get behavioral health care from your primary care clinician, you're going to be much more likely to be adherent to whatever treatment there is. Next slide. And then this slide just kind of reemphasizes what was discussed earlier, that we have a very collaborative model. We can't do what we do without collaborating with all of the other safety net providers here in town. Next slide. Across all of our programs, pre-pandemic, we see between 8,000 and 10,000 people a year. Next slide. And this I just like to show because it's so, the visual is so great. So we have at our Caroline Street Clinic, we have a 6 operatory dental clinic. Next slide. And look at the difference. Next slide. Yeah, isn't that great?
Slide. Thank you, Francis, and especially for those pictures. Sometimes pictures are worth 1,000 words. Before I start, I just want to say how exciting it is to be here alongside Francis and actually looking into all of your faces, not behind a Zoom camera. So many of you I've gotten to know over the past 2 years as I joined leadership at Avenue 360, but always with a filter on. And so it's amazing for us to actually be in the room together. And I think that's something to be celebrated. So I just wanted to take that moment as I felt it looking out at all of you, how amazing it is to be in a room with people. In any case, next slide. I wanted to take a moment to talk a little bit about Avenue 360 Health and Wellness. We are also a federally qualified health center. Our model allows us to prioritize people who are unstably housed or in public housing, but we take care of people from all walks of life. Our mission is to ensure that we engage communities. Oh, you went too fast. I want to go through the different pieces. Go back one. Thank you. That we engage communities in ways that are community-centered and are patient-centered. No one's turned away because of their inability to pay. We want to work not just on the treatment of disease, but also the prevention of illness. We believe that health isn't just the absence of hypertension or HIV or mental health disorder, that health is really what we all think of when we're having a healthy day, right? You have physical well-being, you have mental well-being, you have social well-being, and that housing is critically important to that. In fact, just feeling loved and supported is an important part of that. If you think about your own life, if you woke up this morning and you weren't able to have breakfast and your partner griped at you about the socks you left in front of the bathroom, and so you feeling a little frustrated about that, and you don't have a safe place to go home to, you may have no diagnoses and you may not feel whole and healthy. And so we think about health, we together think about health in a little bit of a different way as we recognize that the wraparound services sometimes are more important than the medication that's received or the diagnosis that's received if you don't help people through it. Next slide. So we recently updated our strategic plan, and so our new vision is to be the provider of choice. We want to be a space where people from all walks of life can come and can feel proud to receive care. So it's not that you're going and you're getting the indigent care, but you're getting excellent care, whether you are indigent or not. To do that, we have to partner with many of the people in this room in order to provide the things that we cannot provide. Partnership is of critical importance. Relationship is of critical importance to enable us to do this in Texas, which is the country in the United States with the highest rate of uninsured in the entire nation. So the bar that we have here in Houston of the healthcare need, it's almost this enormous crevasse of healthcare need, and it cannot be filled by healthcare providers alone. We need the support of all of these wraparound services to help people actually engage in full health. Next slide. Now, in terms of the services, we have 7 primary care clinics and we have 1 hospice. We provide great cradle to grave care, so pediatrics, adult medicine, OBGYN, dental services. You saw the amazing pictures of what a smile can do. Immunizations, therapy. We also recently are one of the first programs in the country to provide screening, brief intervention, referral, and treatment for people for substance abuse for all the clients across our entire 35-mile footprint. It's a very different model. Often we wait for the clinician and the patient to confess to each other that something's going on. We're going to take the model that's affirming and just ask everyone, and then provide the services and link them to those services. So very exciting. We also have some subspecialty elements that we provide, such as HIV care, which is near and dear to my own heart as an HIV provider. Next slide. So in recognizing that the healthcare services are only one element, a core element, one element of what we do, we have many other team members. We have housing case managers and community health workers that go out into the highways and byways, providing health education, but also linking individuals to care. We could not do what we do without those folks who are working outside of the clinic walls to ensure that people are engaged and navigated through the process. We also have case management and lab, radiology, screenings for STI and COVID. I don't want to say it aloud, because I don't want the numbers to go up. So COVID, substance use screening and treatment, as well as both Class A and Class D pharmacies to support people who are in need of medication. Next slide. Now, in terms of housing, Avenue 360 promotes housing stability for those unstably housed, and we provide assistance with housing and food access, transportation, mental health services, recovery services. We've for over 800 households, and that represents over 1,200 men, women, and children. The services range from things like housing for people with AIDS, to tenant-based rental assistance, to a variety of programs that all serve to stabilize this housing piece. And I see Melody, who's actually a really critical partner for us, as many of you are, in getting this done. Let's look at Todd from Court Furniture. I mean, so many partners that really make this possible for us. Next slide. Food insecurity is another of the core. There are many social determinants of health. We've identified a few that are really core to people doing well in Houston. And what we've noted is that food is a real challenge here, exacerbated by COVID's presence. I should always say COVID's presence. We were able to provide food for over 2,700 individuals and families. And again, key partnerships. So this was in partnership with the Houston Food Bank that we started to have Saturday food drives. And I'll tell you that we had the food drives and then COVID hit, and the food drives, the food would be gone in like an hour. And the lines were going out blocks for people just desperate to actually have sustenance. We also have 41 households participating in our health equity department who receive financial assistance as well. Next slide. Now, one of the programs that Francis and I work on together is called the SOAR program. I love gorgeous acronyms that sound amazing and that represent what they do. Soaring. Through expansion from the Texas Department of Housing and Community Affairs, we are able to support the Social Security application process. And so that means for people who have been marginalized in so many ways, it can give them hope of access to funding. And because we are healthcare facilities, we can also facilitate some of the things that are uncovered as you're working with someone through that. We're actually working through the logistics of that right now, figuring out, well, how do we seamlessly get people into mental health screenings and physical health screenings so that you can support their application in the most robust way, and then get them the care they need as well when those items are identified. Next slide. So COVID, let's talk about COVID. So I think that to talk about health and homelessness in this particular season that we all are in, and not to talk about the enormous international elephant of COVID would be a misstep for us. I think that, Francis, you'll agree that COVID actually completely changed the ways in which we do business and the ways in which we provide health.
And it will continue.
Yes. So in many ways, COVID is one of the greatest scourges that some of us will have seen in our lifetimes in terms of both the health and financial and societal transformation impact that it has had. However, with each challenge is opportunity. And from the dregs of COVID came all types of creativity, as I had to ask myself, gosh, I have all these clinics. I literally joined the agency 3 months before COVID hit. And because I'm an infectious disease provider and I'm master in public health, like my first week, I said, there's this thing that I read about in Asia. Can you tell me what the plan is for preparation? And so a staff member hands me a paper, one sheet, and that was the COVID response plan. Thank you so much. Do you understand that this is going to impact every element of the way that we do business? I've never seen anything like this in my entire career. Go back, revisit the page plan. So then came back with a 10-page plan about the healthcare and da-da. I said, no, you don't understand. This is going to be crazy. It's going to take out staff. It's going to make people not want to come to the doctor. We're going to have to figure out how to keep people safe. It's airborne and N95s. So they said, Dr. Flash, do you just want to write it? I said, no, I don't want to write it, but let's partner together and get a robust plan. So we ended up with, I think it was 35-page plan. I had no imagining that COVID would be actually what it has been, right? I said, oh, we'll contain it within our country, if it comes. It's transformed how we do probably forevermore. But from that came creativity. I was a telemedicine naysayer in many ways. I'm a physician. I believe in touch. I want to put my stethoscope on you. I want to smell the cigarettes and say, oh, how many cigarettes did you smoke today? Right? I want to see when I walk into the room and you haven't gotten to the table and I help you on the table and I watch you get on with a challenge and I say, is your back hurting? And they say, oh yeah, I forgot to tell you, right? So the experience, the patient physician experience is an important part of the element, but clinicians were nervous. Patients were petrified. How do you provide care for people when they don't even want to get close to each other? Telemedicine became something that wasn't a, should we do this? It was, we absolutely must do this if we are going to care for this community, keep our team members safe and actually provide the care that they need. So part of the response though was, for the people in this room, likely telemedicine is no big deal. Most of you, are watching your cell phone under the table while you're listening to me talk, right? So you have access to technology. The challenge though, for people who are serving, as many of us are, people who are unstably housed, some of them don't have cell phones or they don't have access to Wi-Fi, or what they have is like, every other minute you have a little bit of Wi-Fi. And so we said, well, how will we care for these people when they don't have access to the technology that the general populace has? And so how can we bring the healthcare to those spaces? So we piloted a program with another amazing partner, New Hope, to bring telehealth to their residents by bringing in the picture of the robot looking guy there. It's a med pod, and we brought them to 2 of the facilities we serve at New Hope Housing and set up a program that people could come down, engage with a medical assistant who would help them navigate the technology, because there's a barrier there, right? And how do I use this thing that kind of looks like a robot, and engage with a clinician at one of our clinics. We thought this was amazing and innovative. Well, after a few months, we said, gosh, the numbers are much lower than we thought they would be. Let's go in and ask the clients again, how's it going? What's good? What's bad? And they said, well, we want you to lay your hands on us. We want someone to put their stethoscope and we want to talk to a human being and we don't want to talk to them through a screen. We want that interpersonal touch. We had no idea. We thought that, oh, telemedicine would be amazing. And the first people that we did needs assessment with thought it would be amazing. But I guess when they got there, they're like, oh no, we want to actually talk to the doctor. So we spent more time transporting people over to our clinics and actually engaging with the med pods with them. So we said, okay, go back to the drawing board, because the lesson learned there is you have to listen to your clientele and they're allowed to change their minds. Next slide. So we adapted our response and said, okay, it seems as though there is a need to bring the schools to access in-home mental health services by actually having the therapists who were dual therapists and case workers go to their homes and actually perform the screenings, provide the therapy there for them, both at our New Hope housing sites and in some of our scattered site housing spaces. Amazing. We noted that nearly 40% of patients had a demonstrated increase in number of healthy days, right? I learned my lesson. I told the team, I said, okay, the next thing, I know that I'm the science nerd on faculty, all these places, but the next time we do this, we're going to have a measure. Then you're going to come back in 3 months and we'll show the change in the measure, because we're not doing the med pod thing again, where they said, oops, we put these machines there. So we have this measure of HRQOL, which are health-related quality of life. And so we follow that over time to ensure that what we're doing doesn't need a pause and a revisit to have more conversation and needs assessment. 43% of the patients have been seen at least 3 times. And the mental health treatment improved the individuals, not just their actual physical and mental well-being, but their perceived physical and mental well-being. And that is a big difference. Even some of you will think, you go to the doctor and the doctor's like, nothing's wrong with you. And you say, something is wrong with me. I told you my right elbow always hurts every time I go like this. And the doctor thinks, well, that nothing's pathologically wrong with you, but you don't feel healthier. They didn't do anything for you. They didn't give you a prescription. They didn't make you feel better about whatever it is that you were expressing as a concern. So having that perceived improvement in health is almost as important as actually improving health. Having that person who can come to you and talk with you in your own space and observe your life allows them to really get to nuts and bolts of, you do feel better. Look, before you couldn't pick up your grocery bag and now you can. Next slide.
So I'll talk a little bit about the COVID response with Healthcare for the Homeless Houston. Some of our experiences, and we talked about this, were actually very different. Early on in the pandemic, the city asked us to be sort of the official testing site for people experiencing homelessness. So we tested mostly at either the Cathedral Clinic near the Beacon or at our Caroline Street Clinic. Like everybody else, our clinicians were frightened in the beginning. We had one incident that we laugh now, but it was not funny at the time. A woman came into the Caroline Street Clinic. She was back in the clinic and she started coughing and everybody fled, including the provider, just fled. And then they got hold of themselves and went back in, and she had pneumonia, not COVID. So it was, just kind of a touch point for us. One of the things I wanted to talk about, and overall, we've to date, we've tested over 1,500 people and vaccinated almost 1,200 people that are experiencing homelessness. So we've done quite a bit. We also did surveillance testing in the shelters to go in to try to see how shelters were doing, and we identified 3 outbreaks that then the city could come in and work with that shelter. The different experience that we had was with telemedicine. We had bought a MedPod, didn't use it with telemedicine, but we had one of our providers, 2 of our providers who were providing telemedicine, and our patients loved it instead of hating it. So what the difference is, Dr. Flash and I haven't figured out, but our no-show rate for psychiatry went down 350%. So it's just a difference in either approach or population, or I'm not sure what, but it was a very different experience than what Dr. Flash and her staff went through. And I think we were going to, do we have one more slide? Okay, good.
And I think this
Oh, yeah.
example that we give of difference is profoundly important. Sometimes as leaders, you look at your own agency and what you're doing, and you look at it in you look at the glass and you kind of focus on here, when you really have to look out and say, what I do in community A might not work in community B, right? And what I do with provider A might not work with provider B. And there is an incredible need for the discourse, lessons learned, but also to listening to the communities and not trying to make them all a one size fits all, but actually recognizing their difference, embracing their difference in a way that allows you to actually serve them and affirm them. And so whether it's the population is more street homeless than unstably housed in permanent supportive housing, or whether it's the corner of the world of Houston with its diversity, race and ethnicity, or their gender identity, or whatever it is, there is so much difference, beautiful difference in our communities, and we need to pay attention to that difference, not try to cookie cutter it, but figure out how we need to adjust what we do to affirm all of those spaces. So as we were thinking about how do we close this out and what are the lessons learned, one of the things we thought we would share is this power of needs assessment and iterative response. Just because you decided that this is the path forward, if a COVID Mack truck crosses in front of you, you pause and you say, okay, well, maybe that isn't the best path, right? And so the ability to pause and say, are we doing the right thing? Have we looked at the measures? Have we set up measures to actually see if things are going well? And have we talked to the communities that we're engaging with, affirm them to have voice to influence what's happening?
So we had an experience like this. Both of our agencies are working with the Housing Authority on a United Healthcare grant, trying to look at health and housing. And we've been meeting forever. Forever. And we started going down a path looking at diabetes. And at one meeting, I just kind of stopped and I said, we're going down this path and we have not talked to any of the people that are living in permanent supportive housing to see whether or not they're interested in this path. So we had 3 different focus groups, 4 or 5 different focus groups. And the thing that emerged that was the most salient was social isolation. Not diabetes, not hypertension, none of those. It was social isolation. So now we're in the middle of trying to figure out what our intervention is going to be. And then that's what we're going to focus on, rather than what we had started out assuming would be the path that we're going on.
That's right. It was, once we got over the amount of meetings we had to figure this out, it was transformative in terms of how we're going to now approach what's become an exciting project. Before it was just, oh my goodness, another meeting. I'm not a meeting lover, but I am a lover of change and of making powerful impact in community and of reinforcing my perception that health is not just about absence of disease. We like walked into the same wall again, right? Talk only about diabetes when it was the social isolation, which is that broader definition of health. Social and mental well-being are driven in many spaces by social isolation. Healthcare outcomes are as well, right? When there's no one to say, hey, did you take your medication? Or I need a ride to the doctor, or gosh, I have a handful of pills and I'm just so sick of it. Having someone who can say, you got it, you got this, here's some water, or open your mouth. That helps. So social isolation will help with those other features, but we have to go from a patient-oriented or client-oriented approach. So the next lesson learned was that one size does not fit all. When I talk with other leaders in Houston, I say, you know, I am a very competitive person because I try to be excellent. But my excellence does not outshine your excellence. I believe that we can all be excellent together. That's why I moved from where I was to come to Texas, because I was like, listen, there is so much healthcare challenge here for us to address. There is room in the pond for everyone to have their level of excellence, and there is going to be an imperative for us to work shoulder to shoulder to solve these problems. I can't solve the problems of how health and housing integrate without the wisdom of Mr. Nichols, right? I can't do it without other partners who have the expertise in dealing with the literal street homeless population. So we need each other, and we need to engage in the wisdom of what people who've been walking different roads can share. The third lesson learned, they took my slide away, but the third lesson learned was the power of a pandemic. And I think that that's a lesson for us in many ways that, and I tell my leadership team this often, I said, you know, one man's crisis is another man's opportunity. And so I think we all in this space, in many ways, have all become patients of this COVID, right? And there's one way to look at it, like, oh my God, this horrible thing, I'm so glad I take my mask off and I can go on the plane or whatever I can do. Or you can say, gosh, this is an opportunity for us to reframe how we engage so we can do things in ways that when the next COVID comes by, we are prepared and we know what to do. We can do it more rapidly for a shorter season, get it under control so we can all move on to, you know, barbecues and flying and healthcare face-to-face where you put your hands on your patients. So immense lessons learned, amazing partnerships, and an honor to stand before all of you and to serve alongside all of you. Thank you.
Absolutely.
Thank you so much. Well, firstly, thank you for the courage that you and your teams have exuded during COVID-19 when we were living in this fear of the unknown. We cannot thank you enough for all of the service that you all have given to the clients with their well-being. So thank you so much. Our next topic of the morning is advocacy. The local homeless response system, The Way Home, is making plans to become more active advocates for people experiencing homelessness, especially at the Texas State Legislature. Today, we've invited an ally from the network of behavioral health providers to tell us about some of the advocacy work they did in the last session and some overlapping areas of interest to demonstrate why it's so important to engage. Sydney Carter is the program and policy coordinator at the network of behavioral health providers. Sydney has led legislative efforts and has helped to build up NBHP's policy expansion reach. 3 of NBHP's priority bills relating to mental health and substance use disorders passed last session, thanks in part to her work. Please join me in welcoming Sydney Carter. Thank you.
Good morning. Thank you all so much for being here. I will admit I'm having a little bit of imposter syndrome speaking with all these amazing speakers. So I really appreciate y'all being here and listening to a little bit about advocacy. So I'm going to try to see if this clicker will work. So next. Okay, great. So again, my name is Sydney Carter. I'm with the Network of Behavioral Health Providers, and we are a collaborative of over 40 mental health and substance use disorder service providers across the greater Houston area. And we're blessed to have a lot of our members here today. I'm so excited to see a lot of you. And I'm very excited to speak to y'all about policy, advocacy, and opportunities for homelessness and housing. Okay, let's make sure it doesn't go. Okay, so here is what I'm going to cover today. So I am going to talk about advocacy and its importance, as well as some of the work we did during the last legislative session around advocacy at the Texas Capitol, as well as our priority issues that are relevant to a lot of you all. And I'll go into some of the issues that we were able to have successes in, as in bills that passed. Also, some future opportunities relating to homelessness and housing. Go over a little bit about the Texas legislature online website, which is where it's kind of like the go-to shop for advocacy at the state level. Also going through how to look up legislators at the state and local level, which is really important to all of our work. And kind of like I mentioned, the local level city council and commissioners court, how to communicate with legislators, and then some next steps. And I know that there could be a variety of levels of who has engaged in advocacy and at what level. So this is going to be kind of what I would consider a 101 level. And if you have any further questions, I would love to talk more about this. I love this work and I'm happy to provide any assistance I can in this area. So my first slide has to do with advocacy. Of course, the definition at the top by the Alliance for Justice. They're an awesome organization that does a lot around the legalities of advocacy and lobbying. You can learn a lot from them. But so I wanted to start with what it looks like to be an advocate. So firstly, advocacy is anything that is trying to make influence on an issue. So for example, if you're speaking with legislators at any level, sharing your story, sharing facts, trying to convince them that your issue is important is really powerful. And I and many people that I've worked with have seen it happen and seen change occur. Legislators can change their minds on issues no matter what side of the aisle they might traditionally be on. With proper advocacy, they can change their mind. We've seen it happen, and we've been lucky enough to have a lot of issues passed because of advocacy. And the last point on this slide has to do with 501c3s, which is what many of your organizations are. We can and should advocate. I think there's a little bit of miscommunication around advocacy versus lobbying, and anyone is allowed to advocate, and it's powerful. Let's see if there's anything else. Oh, the last point under that, considering your work day. So I bet a lot of y'all go throughout your work day and there's some kind of regulation or little annoying thing that impinges on your ability to serve clients. And you might just kind of be thinking, oh, I wish I could get around this regulation or this legality, and it's making a negative impact on how I can serve my clients. Advocacy is a way to help make change in that area. You can advocate to better serve your clients. Let's see if I stand here. Okay, great. So these are the priority issues that NBHP advocated for during the last legislative session, which is about January through May every 2 years in Texas. So it'll be coming up again in January 2023. This is from 2021. So our 5 issues, of course, you'll see a lot of the words increased are starting because we always need increases in every area in behavioral health. So the issues have to do with funding, increasing telehealth options, increasing jail diversion options, increasing recovery housing, which is relevant, to our work here today, and expanding Medicaid. So these are some policy wins we would consider from last session. These are 3 bills that we advocated for, we testified for at the Capitol across numerous points in the bill's life. So HBs 4, HB 133, and HB 707. HB 4 had to do with that telehealth piece, with increasing access to telehealth. HB 133 had to do with postpartum care for mothers, including care for postpartum depression, so mental health care. And HB 707 related to a study about the current state of recovery housing in our state, which is usually the first step towards more meaningful changes. The state will pass a study. Okay, we'll do a study on what this is, and then we could go to further action. So though it might not sound like a big deal, it really is, because it's starting to show the state how important recovery housing is and bring light to housing. I might need to stand here to change the slide. Okay, great. So this slide is some sample data we have presented to legislators relating to housing. So these 3 points are examples of what I have shared with legislators, kind of helping to convince them of my point of why housing is important, why it is something that they should care about, should pay attention to. So I think a lot of us might be familiar with some of these statistics. So the first point about how around 53% of people experiencing homelessness have co-occurring mental health and substance use disorders. If Councilmember Thomas was here, she has heard me say this to her and all the city council members, all the commissioners court members, all the Houston delegation at the state level. And the second and third stats have to do kind of with the cost effectiveness of housing someone versus them experiencing homelessness with any type of serious mental illness, et cetera. And the last point is an example of what we would specifically ask from legislators. So we have had this on our 1-pager, as well as kind of just stating it to them. The legislature should leverage federal funding to expand housing as well as short and long-term housing options. So having a specific ask is another really important point. These are some other bills from the last session that had to do with housing, recovery housing, permanent supportive housing, homelessness, et cetera, that I think could be future opportunities for this coming session in January. So if you have access to these slides after, I believe these links will be clickable, as well as the policy wins slide. You can learn more about them on the Texas Legislature website that I will go over in this presentation as well. So these are just some bills that have relevance to our work that could come up again in the next session, or could be areas that we advocate for at the next session. So now, like I mentioned, I want to go over the Texas Legislature online website. This is where you can basically learn everything about advocacy at the state level. So I will go here. So this is the Texas Legislature online website. I would like to be able to click the link and show you all this. That is what I would typically do at this presentation, but I hope that these screenshots do show enough kind of explanation. And if you would like any type of tutorial on this website, like I mentioned, I'm happy to do that. It is seriously no problem. So this is the website for the state. You can see on the left-hand side, the House and Senate. You can click on their home pages. You can see the different committees on the House and Senate side. You can see who are members of those committees in terms of House of Representative members and senators. You can also look in the middle top section for specific bills. Like I mentioned, HBs 4, 133, and 707. And I should have said before, HB stands for House Bill and SB would be Senate Bill, if you ever see that come up. So there's a lot of stuff you can do on this website. As well as the bottom right, it's kind of cut off, but who represents me, you're able to look up your legislators and learn who you might want to meet with depending on your address or your agency's address, et cetera. So This is a expansion of the Who Represents Me section of the website. So this is the address for NBHP, the Network of Behavioral Health Providers address. And we can see Congressman Al Green is our US representative, which would be the same for a lot of us, and our state representative, Sean Theory, and our state senator, Boris Miles. So you can easily see that from this map, and you can look up any address. So this is an example of what would pop up if I looked at a specific representative. This is Representative Cristina Morales, and she is representing District 145. And so you can see this for any member of the House or Senate. You can see a ton of information on this section of the website. We can see her capital address, her regional address. We can look at what bills she has authored or sponsored and kind of go through that to see what they might be supportive of, what they have been supportive of in the past, et cetera, which can help learn who your allies are, who your potential opponents could be on an issue, et cetera. You can see a biography about them. So there's just a lot of information here about your representatives. This is the committees tab of that same page. So you can see the different committees, and I'll go into this a little bit later about what might be relevant. So for example, when a bill is authored and written, it would then go to a committee. If it gets a committee hearing, that is an opportunity for advocacy. So for example, I just got an email this morning about, we're in the interim is what it's called. But during the session, this happens a lot more frequently. A bill is up for a hearing in a committee after it's been assigned. And so once it's in a committee hearing, you can go testify in person in Austin if you would like. You usually have 1 to 3 minutes, which seems short, but you're really able to condense the most important information and get the job done. If you don't want to go to Austin, you can also do written testimony. You can submit it, which usually does not have a word count limit or anything like that. Or you can drop a card of support is what it's called at the Capitol or online. And so there's a lot of different ways to engage, and you can do it as a member, kind of as a representative of your agency or as a private citizen. I'll talk about that as well. But I really want main point of this to kind of come across that anybody can and should engage in advocacy for issues that they care about, because it is really the most impactful way to make meaningful change. These are some different state level committees and departments that several of us have mentioned this morning already, so I don't want to go into it too in depth. But at the state level, the Texas House, the Urban Affairs Committee, the Texas Senate, the Local Government Committee, and the Texas Department of Housing and Community Affairs, and more. So there, as bills, like I mentioned, go through 2 committee hearings, you are able to kind of just follow where they are. So it might not come up in a traditional committee. For example, many of the issues I would testify for are in health and human services, but there might be one that randomly comes up in local government or whatnot. So if I have to go to that, that's okay as well. This is the local level, city council, commissioners court, and the local city and county levels have their own housing departments as well. And this is an example. I testified in support of the Housing Navigation Center and the COVID Community Housing Program. And so did many of you. And that is a prime example of advocacy and how it does work. So those issues both passed thanks to a lot of your advocacy. There was a lot of opposition to those issues. And it kind of definitely shows how advocacy can make a change. So this is ways you can communicate with legislators through email, phone call, written letters, or advocacy alerts. This is a sample email I would have sent to a legislator in 2020. I just briefly introduced myself, my organization, my position, which you don't necessarily have to do. And then I just kept it brief. I said I would like to meet with you virtually at the time. It could in person now about these issues. Please let me know some dates. And that's just how easy it can be. And they or someone at their staff will respond. And if they don't be afraid to email 2 or 3 or 4 times, because I have done that. And sometimes they do miss it. They're busy, you know, their emails are full. So it is okay to be diligent because they are your elected officials and you are able to speak to them. This is a sample for calling legislators. So saying, again, this is a voicemail, my name, my agency, why I want to speak to them and ask for some dates. That's a voicemail, just an example. But if I was speaking with them, if they did answer, they might try to start scheduling immediately. So definitely be ready to have some dates and times for that. Of course, leave your email, your phone number, all that at the voicemail. snail mail, so physical mail. Of course, all the representatives have state and regional addresses. You can send it there. If you would like, you can send them a letter. And then how to interact with the legislators. So you've got a meeting with them. Congratulations, whether it's virtual or in person. Make sure you follow some of these items to kind of make it an effective meeting. So going in with 2 to 3 people, if possible, 30 minutes, keeping it short and sweet. Make sure you go in with a plan for the meeting. You want to have data and points to back up your issue that you're wanting to talk to them about, and making sure that you arrive early, especially at the Capitol. You have to go through security. I'm not sure how long they will continue to require COVID testing, but that does take a little bit of time as well. So just making sure you are following time for the precautions. And if you are at the Capitol, it is huge and confusing, especially if you're new. So definitely taking time to look at a map, figuring out where the office is that you're going to. And a good point on this is bringing a one-pager, bringing something that they can keep, perhaps a business card, and making sure that if you don't know the answer to something during the meeting, just say you don't know. They much appreciate that compared to making up some type of data or something and say you'll get back to them with the answer to their question. So this is tips for taking action. Like I mentioned, you can take action as a private citizen or on behalf of your organization. If you are taking action on behalf of your organization, just make sure you are cleared to do so. You're allowed to advocate versus lobby. There is that difference. And like I mentioned, Alliance for Justice has a lot of good trainings on the legal aspects of that. This is an example of a legislative alert. So you all may have seen this from NBHP. When a bill reaches a certain point in the life cycle, it will go to where you can testify or you can do advocacy alerts, et cetera. And so you'll see these from NBHP, and you might see these from other organizations like change.org at a national level. And I would encourage you to participate because it is a way to kind of flood representatives with points on an issue and showing that people do care about it. So to wrap up, next steps. Of course, I would like to ask you all to follow NBHP on social media as I post on there. I help run our accounts, and you can see some of our legislative work on there, but it'll mostly come through advocacy alerts and newsletters and emails, etc. Last slide. So this is my contact information. Like I said, thank you so much. Please feel free to email me if you would like to learn more about this. NBHP does do Advocacy 101 and 102 trainings on this. And also in any of my free time, I'm happy to answer any questions about this because it's good to kind of be trained on this and be ready for the upcoming legislative session in January. And learning in the interim is a really good time because things are a little bit slower. But with that, thank you all so much. I really appreciate your time, and I'll be around for questions. Not at this moment, but I'll be sitting down. So thank you so much. I see Ashlie. Thank you.
No, thank you. Thank you so much, Sydney. I actually just like the NBHP page, so can't wait to follow that. So at this time, we will take a short break. So please enjoy each other's company, and we will get the program back started at 10:30. Thank you so much.
All right, as our panelists are getting settled in, we just want to thank you again for joining us for this 2022 State of Homelessness Conference and Luncheon. So welcome back. Everybody? Okay. Our next session is a panel discussion that will shed light on how different systems and sectors are breaking out of their silos and working together to end homelessness. Our moderator will be Marc Eichenbaum, Special Assistant to Houston Mayor Sylvester Turner for Homeless Initiatives. Marc is a licensed attorney who specializes in public policy and strategic communications. Please welcome Marc. Hi, Marc.
Thank you.
Thank you.
Actually. All righty. So, before we begin, I was speaking with the mayor earlier this week, and he really wanted me to convey one message. And that is, so often when we hear the word first responder, society thinks of, or they're referring to police and fire. But the mayor really looks as the folks who are working for our homeless agencies are first responders too. And the pandemic only increased the definition to really include frontline workers such as healthcare workers. But those working in our homeless system are also frontline workers. And so if you personally or if your staff did, please tell them thank you. Thank you for still doing outreach, housing navigation, keeping the shelters open, all during the pandemic. The mayor and the city really appreciates theirs as well as their family sacrifices. So thank you to all of our frontline first responders within our homeless agencies. Alrighty, so to set the stage here, there's lots of folks here that are already really familiar with the way home and the system transformation that has happened since 2012, but we understand there are some here that aren't. So a quick primer, and that is back in 2011, the mayor at the time worked with the stakeholders to say, we're spending tens of millions of dollars on homelessness, we're getting anecdotal stories of success, but we're not moving the needle. And we're managing the issue, but we're not solving it, and we need to do something different. And so the community came together. Many folks in this room came together and said, we need to start working on creating a collaborative system, and we need to embrace the best practices, data proven, of housing. And so that started it off in 2012. I know Melody Barr knows the housing, the Veterans Initiative started. We first tried pilot programs with that, and they were really successful. And folks knew if we just started working together, collaborating together at a high level, using best practices, we could actually move the needle. And it has. And you heard the stats earlier. Since 2011, a 64% reduction in overall homelessness, major reductions in unsheltered homelessness, reductions even in our sheltered homelessness, and it's been huge. And we've gotten there by really working together. So that's the theme of today: is how we have gotten here by collaborating, and where do we go from now? So we were going to have a starting lineup for all of our panelists. Unfortunately, the hotel said no to smoke machines and my pyrotechnics. So unfortunately, the way we're going to do this is I'm going to start with a question. And then before you each provide your answers, I'm going to say a couple words about you. Everybody here is a program. I'm not going to give you the full bios. We don't have enough time. So, but for those that don't, I'll make sure to say a couple words so you know why these four individuals are so important, why they're up here today. So to start with, the first question is going to be, each of you represent different systems and different sectors. How has your system collaborated with the homeless system, and why? So Barbie, you're going to be first up. For those that don't know Barbie Brashear, she's amazing. She's been in the domestic violence and sexual violence fields for over 26 years. She's an expert in more things than I can say. She's currently serving as the executive director of the Harris County Domestic Coordinating Council, and she's also the chair of our steering committee for the Continuum of Care, which is over the way home. So Barbie, you're going to first start off. How does the domestic violence system coordinate with the homeless system, and why is that important for you?
Thank you, Marc. I'll try to be brief because I could talk about this for a long time. The Coordinating Council, and along with at the time that Marc was mentioning, around 2012, began exploring coordinated access because of VAWA legislation and issues related to the significant confidentiality needs of those who are fleeing domestic violence. Entering into an HMIS system is not possible, nor is it safe. So the providers came together and started exploring how to set up a separate but similar system. So we developed the one door for domestic violence coordinated access system. And that system now serves as a parallel system to the HMIS system. There's not a way for them to talk to each other yet, but we're working towards that. And the way that we coordinate and collaborate is domestic violence families make up a significant and majority of families who are part of those being served by our homeless systems response dollars. We only have a limited number of domestic violence specific housing. So the need to have access on both sides is imperative. Families that never reach a domestic violence provider are going to come into the homeless service provider system for help, and yet need safety planning and risk assessment and advocacy and the very specialized supportive services that our domestic violence experts are able to provide. So we collaborate in that way. So we're providing those services to that part of the system. And then we are also serving the highest risk, the most vulnerable in need on the domestic violence side with that housing.
Thank you, Barbie. All righty, Mr. Bob Eury, 38 years as a president and CEO of the Central Houston and the Downtown Management District, an architect, an urban planner, affectionately known as the mayor of downtown Houston. And even Mayor Turner would say that. But Bob has been since the beginning, since the conception of The Way Home, really has the pulse of the business community and knows the private sector better than anybody. Bob, why is it important for the private sector and the business community to work with the homeless system?
Thank you, Mark. First of all, let me just say something right now that there's a new mayor of downtown. I want to make that very clear to everybody. I am retired now, and I just want to make sure that we all got that straight. You know, for the business role, and you just said it, 38 years, it dates way back, I think almost to the same age as the coalition, if I remember right. I can't remember the exact date the coalition was founded, but yeah, and we were formed in '83 too. So it's really the same thing. I think our role has really been, when you look at the redevelopment of downtown, one of the issues that most downtowns in America face is really the presence of homeless and street people in their downtowns. It's the center of the city. Frankly, they're safe. It's a place that people can be. It's service rich, and there's many reasons why that there's a higher population there. As a result, if you're really in the role of helping to redevelop downtown and make a place that people come, it's economically thriving and all that, we really must address the issues that face homeless individuals. And so we know that there's an economic interest for us, but there's also an economic interest for the community in terms of really providing housing and services and helping people to be in a stable situation. We know for the community that's of economic benefit as well. The work we've done over time really has been all over the place, but I think a lot of it has been planning and research, really making it more data-driven. And this goes way back in time. Continued advocacy all the way along. The fundraising involved in one way or another. And the way I'll look at that is sort of just-in-time funding. If we really are anxious to move fast in making this happen, we've really got to sit down and figure out what's the quickest way that we can put resources behind the ideas to move it forward. And we all know that sometimes it just takes forever to be able to, it feels like it takes forever to be able to find the funds to do what we need to do. Done a lot of work in sort of system mapping and facilitation over time to help sort of get to where we are. And then as we moved into the way home, I think one of the things we tried to do was help bring leaders in the community together, from the faith community, business community, the foundations, and try to do everything we could to help barrier bust, to really move the way home forward and really make progress in moving forward. And then just most recently, really it started right before COVID, is beginning to look at a much more higher level at where can we collaborate even better and more, sort of cross systems. And so we've had a series of ongoing leadership meetings to just keep trying to work these new collaborations that help us get to where we're even more effective in being able to house homeless and meet the needs that individuals have who are facing that issue.
Bob, that cross-system engagement work is being enabled from the private sector. And I think why that's so important and why that's a big theme today is that another theme you've heard a lot is that we're resource poor here. City side, relatively, we're low tax and we operate with a revenue cap. And when it comes to funding for homelessness, we've squeezed that orange dry. So the problem is when you don't have more funding, how can you increase impact without funding? You have to integrate with other systems and leverage each other. And I think that's what's happening today is we're leveraging and working with each one of these systems in lieu of having more funding to try to increase impact. And the private sector has been amazing. And thank you for all your work. With that, Mike Nichols, former state representative in Georgia. He was a general counsel for a Fortune 500 company. He's was COO for another major local corporation. He served as interim CEO for the Houston Parks Board, and we've been lucky enough for the past 3-4 years to have him as president CEO of the Coalition for the Homeless of Houston and Harris County. Mike, tell us why and what you've seen coming from the outside originally about the importance of system integration between the homeless system and others out there.
I'm a believer in good government. I'm a believer that philanthropy cannot mask bad government and should not mask bad government. What I've seen in the homeless response system is a model for many, many other systems. And that's when you have collaboration between public funders, business, philanthropy, nonprofits, and other stakeholders. You can do great things. And housing 7,000 people this year is a good example of those great things. The coalition is the lead agency for the COC, the Continuum of Care. That steering committee represents many, many different groups. We are very proud that Bob Eury is not completely retired because he's going to be a new member of the COC steering committee, and thank you very much. But the success in Houston and Harris County has been this collaboration, this belief that yes, there are barriers, and yes, we can get through those barriers. The lead agency is the catalyst that stirs it up. It's been my honor to sit with Bob and Wayne and other folks as they develop the R3 Center for our community. It's my honor to sit with Bob and Wayne and other folks as we develop ways that criminal justice system can better positively impact the homeless response system. So it is an honor, Marc, to be part of this collaboration, but I do see it as a model for many, many other social successes.
Thank you, Mike. You mentioned Wayne, Mr. Wayne Young, a true national leader in the behavioral health world. All you need to know is that we were lucky enough to get Wayne from Fort Worth, where he now is serving as a CEO of the Harris Center for Mental Health and IDD, the designated state to local mental health authority here that's serving over 80,000 clients a year. Wayne, the homeless system and the mental health system didn't always used to work together. It's definitely changed, and there's still more work to be done. Why did you feel that it was important for that connection to be made?
Thank you. I appreciate the opportunity to be here today. And I think we should start off acknowledging that Bob is terrible at retirement. He is clearly a retirement failure, and I'm assuming he's going to show up with a full-time job any minute now.
Real quick, I don't mean to interrupt, but I do. Is your mic on? Are we getting?
I'll move it a little closer and see if maybe that helps.
Perfect. Thank you.
It doesn't adjust, so I'll just try and lean down here. So I think we've already heard from several of our speakers today, great statistics around the prevalence of mental health, the disproportionality of mental health being represented in the homeless population, the population that many of these organizations serve. And interestingly enough, the examples that were given were for diagnosis around schizophrenia, bipolar disorder, depression, and PTSD, which also happens to be the 4 primary diagnoses that we see in our system. So there is this huge overlap, both conceptually as well as in reality in our community. And it's interesting to me. So this last year, we spent $37.6 million in providing care to people who were homeless. And 2 years ago, it was like 26 million. So it's gone up a lot, but that's still a lot. Even at 26 million was a lot. I think the challenge for us is a lot of our care delivery was done kind of in our lane and in our path. And I think we were there and present. But I don't think we tried to consider how we might leverage partnerships, opportunities to go in together to provide services in a similar platform or location. And so for me, and part of the calling is, frankly, we received an invitation, right? Like Bob called and said, I'm having a meeting, will you come? And because he was the mayor of downtown, you say yes when he calls, right? And to watch that power of transformation happen as all of those providers and agencies came together was inspiring, right? And it is clear, as we've done in criminal justice systems and other settings, the integration of these systems of care and providers has got to happen in order to be able to maximally serve those that we're charged with serving. right? And as the safety net provider in our community, I feel an obligation and responsibility to be a good partner in that work.
You know, I want to pull the curtain away and be honest. We're in a friendly crowd here. When the homeless system first started having dialogues with the mental health system, there was you know, some sausage being made, and we would say these people are too acute. It's your responsibility, and sometimes we'd be, well, they're homeless. It's your responsibility. How did we go from that period, which was, you know, there's a little conflict or disagreements, to where we are today, you know, really working together? What do you think changed?
Yeah, I mean, I think the opportunity for us to sit down at the table and to work through those conversations and to do it with good intended people who are smart. And at the end of the day, I think it was clear that everyone at those tables were committed to the people that we were talking about, whether the perspective was it's your issue or my issue or whatever. And so when you get good intended people trying to work on a solution focused approach, I think good things come of it, right? And everybody kept showing up. And part of that was to Bob's leadership. Part of that was to Mike's leadership. You know, I've seen many of those meetings come together and not bear fruit, right? And because of their commitment and continued focus on bringing the group together, the repetition and opportunity of that, I think ultimately created some strong alignment and people willing to put it aside, right? There's lots of conversations says, well, you haven't always been the partner maybe that we would have liked to have had, but you're here now, and a willingness to let some of that stuff go and just embrace wherever we are today as a community.
From the other panelists that were part of those meetings, what were some of your observations on how we got over that hump?
My observation, Mark, was that we had the people with the money, being the city and the county at that moment, willing to work together. And that's so important. And it takes a lot, because it's not just the political powers, it's also the bureaucratic powers. And once we had all of those groups saying, yes, we'll each put up some money, things begin to roll.
Yeah, and you know, I'd say instead of us saying it's your responsibility, it's yours, we said it's ours. And then we said, even if we're not the mental health experts, how can we assist and how can we help? How can we support?
Mark, in my opinion, it sort of started on the wall. There's a diagram up there, and you look at it and you go, this is not one player. This is all the players in this diagram. Now let's go back and start working the pieces of it. And the truth is we're still working it. We're not done.
So Mike, you mentioned the county. I would be remiss if I didn't recognize Martin and Leah Barton and Francisco and the others with the county that are here, because they're a tremendous equal partner, and we couldn't do any of this without them. So thank you guys. Barbie, I had mentioned that you are the chair, you serve as the chair of the Continuum of Care. What's it like to balance the interests of the domestic violence system with the greater good and the needs of the overall homeless response system?
I look at it as a great opportunity. It's real easy to stay siloed in our expertise areas and lose track of the big picture for the entire community. And you know, in my seat as where I sit on the COC, having this tremendous opportunity to interface with all of the other disciplines that are represented, where everyone's kind of checking their ego at the door and checking their agenda at the door and saying, we're in this for the greater good. That's what makes it easier. I know you're going to ask us a question about collaboration, and collaboration being the theme of the day, but truly collaboration is hard work. It's truly hard work. It takes time, it takes energy, it takes a lot of resources, and then it takes more time. So, I mean, that's the reality. So working with people that have that base knowledge and understand that makes it easier.
Okay, well, you said collaboration. And sometimes when I hear that word, I roll my eyes because it's overused. Everybody uses it. And it really means different things to different people. But when we say the word collaboration, what does that mean to you? So Barbie, you just said a little bit. Bob, what, in the context of the homeless system, what does collaboration mean?
My sense is it's really beginning to balance your focus on the mission for what you're responsible for. If I'm the head of one of the pieces of the system, but really also really beginning to fully understand and learn what the other siloed entities are, or that might have the possibility of being silos. But it only works when we recognize there's a system, and we can't really make the progress we want to make unless we have everybody participating. So that means I'm probably giving a little on my silo, and I'm really letting, others really kind of help, because we know together that we can do more and we can see it. Metrics plays into that, because if you can measure progress, it makes you want to stick with it, and it's harder to kind of go off your own direction. I think a lot of it also depends, and as I've thought about it, on sort of the fiscal and just health and governance of the various entities that are involved in it. If any one of those entities is in let's say a weakened situation, it makes it much harder. That everybody has to be strong in this, and it's hard because it's a nonprofit world or public world. Funds are always hard to find, and so it's one of those things where we have to be considerate of that. And the truth of the matter is, we all should be advocating for more money for everything that we're doing at this point, because we need it.
Mike, do you have any?
Yeah, I do. Collaboration has a very specific meaning to me in this circumstance. The LA Times had an article comparing Houston and LA, saying what LA could learn from Houston. And it described our system as having good organization, good scale, and pragmatism. And collaboration means to me, when people start looking at this bigger picture to make sure the scale is big enough that we can really make a change, to make sure it's organized in a way that you can make a change, and to be pragmatic. And that's what Bob was focusing on, because we're always looking at how can we help those individuals who are living on the street and living in this kind of desperate poverty. And I think that's what collaboration means to me, this focus on scale, organization, pragmatism.
We've gone around and we've said how your systems or sectors have and currently collaborate with the homeless system. But let's talk about the future right now. What does the future hold? Is there a certain project that's coming down the pipeline? Is there a certain area that's now being explored? But regarding system integration, where do you see the future going? And Wayne, I'm gonna put you on the hot seat. We were naturally just going down, starting off with you.
Yeah, that's great. I've got sorry, I had to move it back. I felt like y'all could hear me breathe. I've got a great example, so I appreciate being the first one. It lets me get out there first and then not have to worry about being redundant. I think a lot of individuals in the room know about the respite rehab and reentry, or as Marc prefers to call it, the wellness and housing center. I think is his preferred vernacular. It's all the same place, right? And it's 108 beds serving people at the intersection of homelessness, criminal justice, and serious mental illness. And we're only fortunate enough to have that center because Marc and other county leaders leveraged their influence and actually helped us acquire that building, get the funds for it. And so we're able to operate. And now the project that's next in line, and that's a tremendous accomplishment in itself. There's communities that come almost every week to tour that site and think about how they might replicate that. And we're hoping, shameless plug, we're hoping it goes to city council in June or July. But the intent is, and we think we've secured most of the funding for a 24-unit apartment complex on that same campus, so that you can literally enter that campus from unsheltered homeless, typically mentally ill, without stability, all the way through to being housed in that same transition and in that same house, in that same campus. And all of that is in partnership, right? It's in partnership with organizations that I often don't understand. We speak different languages. I don't know the vernacular. I literally had to hire somebody to help me translate because we kept saying stuff and I was like, I don't know what that means. And so I had to find somebody that could help me with that. Most of you are probably quicker than I am and catch on faster. But so I think that is one example. We're with the city, we're partnering right now on non-law enforcement response teams. And a lot of those calls are going to be targeted towards individuals that are homeless because they haven't committed a crime. They just need a response group, right? And so we are soon to have 20 mental health response teams in our community to respond to 911 calls. Without that, there's many other law enforcement collaboration investments that the city's made. But there's lots of exciting things that are on the horizon around mental health and the homeless.
So correct me if I'm wrong, but the Harris Center traditionally has not been involved in the housing piece. And you just said you're about to perhaps be doing apartments. How did How did you get there?
Very, very small. I'm still trying to figure that part out. But at my core, I believe that the people and remember, we serve a very specific population. We are a safety net system for people with very serious mental illness. And even in that scenario, most of the 80,000 people we serve can live happily in the community in a very traditional kind of environment and setting. But I think we've all seen the consequences of those few individuals who cannot. Right? No matter what, at least they cannot for the foreseeable future. Maybe we can, with hope and recovery, get them to a place where they can. But in the next few years, that is going to be a transition to get them there. And so if as the organization that's primarily responsible for our community's mental health, I feel like if that's the missing gap, then we've got to find some way to be a part of that solution.
Hard to do without housing.
Exactly.
Yeah. Barbie, what does the future hold with the collaboration between the homeless system and DV system?
Well, I want to start with saying this because we have adopted the mindset of collaboration and systems and not starting over, but using the knowledge that we've learned from one another and learning what using the metrics and the data to tell us the story to how to move forward. And then as our doctor folks presented earlier from the healthcare, crisis brings opportunity, and COVID did that for us. As a community, we saw all of the ARPA funds and the COVID relief funds come in, and it allowed us to get really creative with thinking about how do we meet the true needs. And for me, I've been in this community for 30 years, and a first happened. And that was our city and county partners with these emergency housing vouchers that were coming in. I think we somewhere around 1,100 to 1,200 housing vouchers. And these were permanent supportive housing solutions for up to 8 years for families. This is incredible. And our community said, domestic violence is a crisis. It was pre-pandemic. It's even more now pandemic, and it's going to be post-pandemic because of what we know about disaster. Let's earmark those. Let's dedicate those to those families. And that's what happened. So 25 to 30% of those were earmarked directly for families fleeing domestic violence, our most vulnerable. So these are our families that are suffering with mental health challenges or physical challenges, most vulnerable from the horrible trauma of the violence. So they're at the highest risk for homicide. And those that just need additional supportive services in order to become and stay safer. So to me, that's the future, is telling the story about what happens for those families, because this service, this community said, this is important. And we've got to tell our state legislators, our local leaders, and our national leaders that this is what happened because you invested.
Sure. Bob, the work that the private sector has helped start, especially working between the homeless system and the mental health system. What's next on the horizon?
I think what's next on the horizon, and if you want me to kind of go there, is let's ask a question. How many people in the room here, raise your hands if you're involved in the law enforcement and criminal justice system? Okay, we've got one over here, one over here. Good. But I think that is a huge area, almost what we've seen here with mental health and housing and health, sort of that. I think that the criminal justice system really is one area where it's very complex, but if you think about it, it plays a huge role in the homelessness. It's very often the police, whichever force you're on, or sheriff, you're actually working as a frontline person with it, and then it sort of works from there. I think it's become more complicated, and it's the right thing with the federal court ruling on no, you can't jail somebody that can't pay bond, and I totally agree with that. But it meant that we need a community response to that, because to some extent the jail system was providing shelter in many cases. And then I think as we get further into it, this issue of collaboration gets exponentially hard, working with just the number of different units in the geography of the region. So you have a Houston Police Department, you have the Harris County Sheriffs, you have constables, their own, each one of them sort of in their own little districts and precincts. And then you have from there, not only just the court system, but but then you have the municipal court system, you have justices of the peace, and you have all of that. And I think that is, I think you can begin to realize the complexity of that. And so as we sort of look forward, just like what we've been doing, it's really more a matter of engaging everybody because they're part of the system too, and really opening a dialogue and understanding more about how it works. And so let's see if we can really make this go together for the advantage of everybody here. And most importantly, especially to the individuals who are homeless.
Mike, I can see your wheels turning.
They are turning. My wife claims that I'm addicted to anxiety. I say I have optimal anxiety. And when I look at the future, one of the things I'm most anxious about is affordable housing. I think we are entering into a crisis, not only in the nation, but also for the first time in a long time in Houston and Harris County, in adequate affordable housing. So that's a big picture. How many people here are involved in being landlords? Tamara is, and folks at New Hope. But again, a little like the criminal justice teams here who are here, we are needing to focus on the needs of our landlords and what we can do to have this system better integrate itself with those needs and solve those problems. Affordable housing is the big picture, Mark, but we also need to work on making sure that there's an adequate amount of housing available for people coming out of the homeless system. It's, to me, our next big barrier that we have to work through.
A quick question for Mike and Wayne. The session before this was about advocacy. I think we're 288 days away from the legislature starting, but who's counting? You know, the legislature can be a double-edged sword. This is your time. Quickly, what is one specific issue that you feel is going to be key to get passed or to advocate for in the next session?
Okay, I'll go first. So I think I'd like to pick more than one, but I'll honor the question. I think for us, from a mental health perspective, I think it is trying to find opportunities for funding some probably non-traditional thoughts around stable housing, right? Maybe not a person living in a one-bedroom apartment with the traditional landlord, but maybe it is a staffed group home, right? Where some of these individuals that have some very serious mental illness and mental health needs can be in a safe place with some support. Recovery homes, substance use disorder housing. I think we've got to figure out how do we commit some funding for that in addition to the other priorities.
Mark, my team said I cannot say this, but I'm going to say it anyway. I'm still a believer in advocating for Medicaid expansion. And I think it's the right thing to do and the fiscally responsible thing to do. But they also say you're 70 years old, Mike, and you are a dreamer. Well, that may be right. So in the event of that, I'm interested in other kinds of expansion, like 1115, funding like Wayne said for mental health. Those are things that we can take inch away on and make a big difference.
Bob, you might have something, but I feel that Barbie, I'd be remiss if I didn't get you an opportunity to do a plug for something that's important on the horizon at the legislature that needs to get passed.
Well, I totally agree with what Mike just said. Totally. Medicaid expansion directly impacts women with kiddos, right? It must happen here. I'm with you, Mike. I'm not giving up. We have to continue to fight for that. I think the other thing on the domestic violence realm in terms of legislation is supporting, enhancing, and bringing more dollars into our frontline shelter staff, shelter programs, advocacy programs. That money has to stay protected and it needs to increase. And the money earmarked towards prevention. I mean, if we're going to move the dial, if we're going to make any change here at all, we have to prevent this from happening. One of my mentors, Toby Myers, talks about draining the swamp. That's the key to prevention, drain the swamp. And for us, it's starting early with kiddos, very early, talking about what a healthy relationship means so that those families never end up homeless down the road, right?
Sure. So in Houston, Harris County, we have the mentality that there's no such things as challenges. There's just opportunities. Now, with that in mind, what are some opportunities down the road that we, as a homeless system and as partners of the homeless system, have to seize upon to be able to keep momentum going in the future? So what do you see as that big challenge? Oops, that's a bad word, or opportunity going forward that everybody in this room needs to be mindful of and be working on? Where do I start? Bob, you might. We'll start with you.
Let me take
for
a
sure.
shot at it. You know, I've thought about it because of having a number of years of experience working with homelessness. Those of you that were here in 2005 when Houston helped the folks from Louisiana, New Orleans, be housed from Hurricane Katrina. I think there was a huge lesson that we all learned in the community, because I'll bet you around this room, there are, put hands up here, I bet you a bunch of people were all working on that in one way or another when this huge mass of people came. And Houston took them in. And if I remember correctly, in a period of about 4 to 5 months, we housed over roughly 150,000 people. You kind of look, I've always felt that was one of those things where it was driven by disaster, but it also, one of the byproducts of that was that it really kind of taught us that if we really put our mind to it, we could take on something that big. Because if somebody had come to us and said, Mark, can we do that? You know, 150,000, I think we'd all kind of say, really? How would we do that? We did it. And so it's interesting to me because in many ways, disasters have been unlocked. While they bring some real consequences and real cost, they've also brought resources, and they've also brought new ways that we get together and new ways we see things. And so when you really think about it, the community COVID housing program, disaster driven, really. And look at what we're able to do, and we were able to collectively in this room hustle to put together collaboratively to be able to really make the progress that's been made over the last couple of years now here. So I don't know how you prepare for a disaster coming in the future, but something says, and I've seen it said multiple times, it seems like the frequency of disasters have the potential to increase here on us. But in many ways, we need to continue to do what we've been doing, and that is really be responsive and resourceful and beginning to kind of work off of those to continue to advance what we're doing on a normal day when we, quote, don't have a disaster.
So between the floods, between hurricanes,
Right.
between pandemics, I mean, we have a playbook, and we need to institutionalize that playbook because you're right. The future is looking like it's only going to be more crisis after crisis.
Right.
Mike,
There's lots of crises out there. What do we need to be seizing upon?
I'd say the next crisis is not having a crisis. Let me give you an example. December 31st, 2024, all this COVID money begins drying up. The federal government's going to be tightening down no matter who's in office. And what we have to do here locally is determine how do we overcome that crisis of not having this inflow of money. So the preparation is right there. We have ideas as you work through the criminal justice. The healthcare system has to play a bigger role in housing. We have to solve those problems, but it is coming soon. And again, that's preparing for there's not being a crisis, and the money has to come from somewhere else.
And I think you mentioned healthcare. I think that's a great system, the public healthcare system that's out there, besides the FQHCs that we work with, where there's not a ton of collaboration, and there's really an opportunity there to leverage each other's resources. Wayne, opportunities in the future, challenges in the future we need to overcome?
Yeah, so I mean, remember, I come from a mental health system that's been, underfunded for decades, right? And a part of what we're seeing are some of the consequences of that too, right? I mean, this is a reality of having a system that was, shifted from an institutional to a community-based setting without the adequate resources to support that. However, I think our system first of all, I don't think our system can solve the problems that we have today from a mental health perspective with the traditional approaches that we've done, right? We've got to try different stuff. And a part of that for me is figuring out how we better integrate our current mental health system into the existing providers where they want it. Like, Healthcare for the Homeless has a tremendous system. Avenue 360 does as well. They deliver great behavioral health services. There are some organizations where it doesn't work that way, or they can't, or they're not healthcare systems, and so they can't do that. And so how do we begin to integrate and leverage the existing investment in behavioral health into the community settings that are already there, so that we take care of the people and not, as we traditionally have done, wait for them to show up on our door.
Barbie?
I want to go back to something that was shared with us early this morning by the city council member, and that's the crisis that is developing from the fatigue of our frontline workers. And I'm seeing this across the board. Mike, I want to take a shameless moment here and praise your staff and your team at the coalition, because y'all haven't stopped. Not for a moment. And then when I look at our domestic violence service providers, I know Emily's here from the Houston Area Women's Center, our largest domestic violence program in the city of Houston. Your staff didn't stop. Yes. That's a challenge. And as leaders, we must talk about this and talk about this again, checking our egos, checking our individual, missions aside. Collectively, when you pull just all of these folks that are tired together, that are serving all of the folks that are being hurt and wounded and homeless and battered and abused, and we've got a crisis. We have got to address this.
Okay, so for those keeping score at their tables, we have further leveraging resources. We got finding sustainable funding. We need a debrief after COVID so we can better prepare for the next crisis. And then we got to socialize. We got to talk. We got about the stress that our frontline staff is having, and we need to be really keen and cognizant of that so we can keep going forward in the future. All four of these needs are not the responsibility of just these four individuals. It's all of ours. And I think that's the dialogue that continues on. And I think those are really thoughtful answers, and I appreciate them. We've talked a lot. We've covered a lot. I think we're wrapping up here. If I was to give each of you 1 minute to say something that you feel is an important concept or theme or something that has gone unsaid, but you feel it's really important that you want to convey that to folks. So real quick, everybody gets a minute, starting with you, Wayne.
Oh my goodness.
Surprise.
Yeah, thank you for that.
No problem.
Or challenge or whatever.
Hot potato.
Yeah, no, I appreciate it. I think it is to figure out how we continue to focus on the gains that we've made as a result of COVID, because a lot of positive things have come from it. Clearly it's a disaster, and none of us would wish it to happen this way. But there have been lots of needles moved because of this.
Try moving it closer. You're getting a little reverb.
Is
It
that
might
what
be
it
able to
is?
turn
Okay,
down the sound.
Well, when I was down here before, it worked. So,
Perfect.
So I think it is trying to figure out how we continue some of those lessons learned, how we begin to continue to try and transform our systems so that they work to the benefit of the individuals we serve, as opposed to the institutional priorities that we might have.
I want to first echo Barbie. That was beautiful the way you said it. And it's truth. The folks on the front line need a big thank you. And the second thing I'd like to say in my 1 minute is, please advocate for what you heard today. Advocate with your neighbors, your friends. The public does not understand what we're doing. They don't. So please talk to them. They want to talk about homelessness. It's really interesting to them, but please talk to them and then tell them to talk to the people who are in power.
Very simply put, I think what I would say is let's continue the collaboration. It's been so effective, whether we're in crisis or not.
And I think for me, it's listen. The word that just is echoing through my head is listen. We heard our healthcare folks talk about the importance of doing focus groups. We thought it was this, but when we talked to people, no, that wasn't it at all. We must listen to those with lived experience to inform where we're going, because otherwise we're going in the wrong place.
That's it.
Thank you. This was about collaboration. It was about collective impact. And I think the challenge to all of us today is to go back into our own organizations. How can we internally within our organizations even collaborate better? How can we collaborate better with external stakeholders within the homeless system? And then how can we be a part of the collaboration between the homeless system and other systems that are out there? Your thoughtful responses were insightful and provoking, and we really appreciate your time today. So please, a round of applause for our four panelists.
And for Marc. Thank you, Marc.
Yes, thank you so much, Marc Eichenbaum, for moderating this year's panel. Thank you so much, Barbie Brashear, Bob Eury, Mike Nichols, and Wayne Young. We are now going to take a break for lunch. So please enjoy your lunch, mingle with each other. We will start back at 11:45 with our keynote speaker, Jeff Olivet. I just want to welcome you back. And it is now my pleasure to introduce our keynote speaker, Jeff Olivet, the Executive Director of the U.S. Interagency Council on Homelessness. Jeff has worked to prevent and end homelessness for more than 25 years as a street outreach worker, case manager, coalition builder, researcher, and trainer. He is the founder of Joe Consulting, co-founder of the Racial Equity Partners, and from 2010 to 2018, he has served as CEO of C4 Innovations. Throughout his career, he has worked extensively in the areas of homelessness and housing, health and behavioral health, HIV, education, and organizational development. Jeff has been principal investigator on multiple research studies funded by private foundations and the National Institutes of Health. He is deeply committed to social justice, racial equity, gender equality, and inclusion for all. He has a bachelor's degree from the University of Alabama and a master's degree from Boston College. Please join me in welcoming our keynote speaker, Jeff Olivet.
It is great to be with you all today. Thank you so much for the incredible hospitality this week. My colleague Tamara and I have been here since Tuesday, and we have broken bread with many of you all. We've been out on outreach with some of you. We've spent time in conference rooms and beer gardens and rooms like this, and it's been fantastic. And we're just deeply grateful for the welcome that you all have shown us. Bob Eury earlier kind of asked who was here in 2005 after Hurricane Katrina. I was here in 2005 after Hurricane Katrina. I worked some with Francis Isbell. I worked with my now federal colleague, Anthony Love, who used to run this coalition. Amen. I'll tell him we got that when I invoked his name. I was part of a group that was doing Hurricane Katrina response all over the Southeast. And in that time, it was 150,000 people coming from New Orleans here. The healthcare for the homeless teams, Mary and Scott, who was at Harris County Hospital District at the time, the healthcare for the homeless folks were driving mobile health units onto the floor of the Astrodome to provide healthcare for people who had been displaced by Katrina. We had a lot to learn about how to respond to disaster. And you all have done an incredible job building that muscle over the last 17 plus years. And it is so apparent to me over the last couple of days what incredible impact you all are making on folks experiencing homelessness here in Houston, Harris County, and the surrounding counties. I was really struck by a conversation I had. We had the honor to be out with the Encampment team. We should give them a very strong round of applause. On Tuesday afternoon, we were out with the Encampment team under a bridge. I have no idea which bridge it was or where in Houston we were, but the conversation that I had with a woman there who told me she became homeless last fall. She had been in an apartment for the last 9 years in a relationship with her partner, her common law husband, and he died in October. She was not on the lease and she didn't have the money to maintain the apartment and she became homeless. She ended up in the encampment because she had a friend there and she deemed that was the safest of all of her not so great options. She's now getting connected to housing and finding a way forward. When I was listening to her talk, it struck me that she hadn't failed. We had failed her. We had somehow not been able to create a safety net to keep that woman and her crazy little dog from becoming homeless. We failed her. We also had a chance to be at the Beacon Center and kind of be involved with intake into the coordinated entry system. And I met a young man who, when asked how long he had been homeless, he paused for a minute and said, "I've been homeless my whole life." He'd been through foster care. He had some mental health issues he talked about. He was now staying in vehicles, had no place to be, getting connected for the first time with housing opportunities. How long have you been homeless? My whole life. He hadn't failed. We had failed him. And every one of the systems that he has touched, the education system, the foster care system, the healthcare system, the behavioral healthcare system, we hadn't gotten our act together enough to make sure that that young man never experienced homelessness. Homelessness is not an individual failure. Homelessness is a systems failure. And if we're going to solve homelessness, we've got to fix the systems that are creating homelessness in the first place. We've actually gotten very good at ending homelessness on an individual level. You all do it every day. You've housed 8,100 people in the last year and a half. That's extraordinary. And yet we still have homelessness because we've never solved the systemic issues, the root causes, the lack of support, the lack of housing affordability, the systemic racism that drives high rates of homelessness for communities of color. If we're going to end homelessness, we've got to think of it systemically. You still do the individual work. That's where somebody gets into an apartment. That's where somebody accesses health and behavioral health services and a job and trauma-informed supports. But unless we're going upstream and turning off the faucets, unless we are solving it at a systemic level, we're going to have homelessness with us for a very long time. Councilwoman Thomas talked about the exhaustion that we see among frontline providers in particular, but I think it's everybody who's working on homelessness over the last couple of years. I know many of you have been involved with this work for a long time. I first got involved in homelessness work in 1994. I'm entering my 28th year in this work. I have been accused by some of being a failure because we still have homelessness. It's sort of like saying housing first causes homelessness, because look, we've been at it for a while and we still have homelessness. It's sort of a misdiagnosis of what's going on. But this work is hard. This work was hard when Hurricanes Katrina and Rita hit. This work was hard before the COVID pandemic hit. It's hard now. And those of you who are doing outreach and case management and mental health and substance use work, and those of you who are operating at the systems level, you're doing this in the context of the biggest economic and public health upheaval we've seen in generations. This pandemic has impacted all of us. I'm sure there are people in this room who have lost loved ones, and you weren't able to go to a funeral during the height of the pandemic. You weren't able to celebrate a child's graduation or a family wedding. We've all experienced tremendous loss. Many people who are homeless tonight in Harris County are homeless because of the pandemic. Some are still homeless because of Hurricane Harvey. These things have long-lasting impact. So I want to acknowledge the exhaustion. I'm going to have to leave here pretty quickly after I finish in a few minutes to go to the airport. When I get on the airplane, they're going to come on the PA. First, they're going to say there's no mask mandate anymore, and some people are going to cheer and some people are going to freak out. But then they're going to say, in the case of an emergency, an oxygen mask will drop from the ceiling. Be sure to put on your own oxygen mask before helping others. I think it's critical in the work that you all do every day to remember to put on your own oxygen mask. Take care of yourselves. Take care of each other. Councilwoman Thomas said this is a marathon with a bunch of little sprints in it. It's a good metaphor. I'm going to take issue. She's not in the room, so you can tell her I took issue with her. I used to think of homelessness work as a marathon. Then I started thinking of it as a sprint. Oh, maybe the other way around. I thought it was a sprint in the early 90s. We're going to work ourselves out of a job. Then maybe, it's still here with us. It's a marathon. I have come to believe it's a relay race. And with generations of people who have founded some of these organizations moving on, we're seeing this at the national level with retirements of key allies in this fight, people who have passed the baton to younger generations of people. As I've met the coalition staff over the last couple of days and seen just the incredible talent that the young people on staff bring, you're the next generation in this work. And as some of the folks who have been at this for 25 and 28 and 35 years are beginning to pass the baton, it's yours to take up. I wish it wasn't a relay race, but it is. That is clear to me. What is clear to me also is just the extraordinary work you all have done. You've heard the numbers today, a 64% reduction in homelessness since 2011. 2/3. You've slashed homelessness in this area by 2/3 in a decade. That is extraordinary. And we don't see that in every community. We see some communities doing pretty well. Washington, D.C., my adopted hometown, is actually doing pretty well also. I think they're moving in the right direction on a lot of things. Some of our cities on the West Coast are really struggling. In Los Angeles and San Francisco and Seattle and others, homelessness is on the increase. Cost of housing is through the roof. There are so many other breakdowns in the system that are causing that. You've defied the trends in a lot of ways, along with Milwaukee, along with Washington, D.C., along with a few others. And I've been trying to rack my brain over the last couple or 3 days about what it is you all are doing. I needed to come see it with my own eyes. I needed to come talk with you all and not just hear it from Tamara and our team. When they say Houston's great, we're not sure if it's replicable. I have heard that. I'm trying to figure out how it's replicable. I read the article in the LA Times also saying what Los Angeles might have to learn from Houston. And the night before I came here, I was sitting in a restaurant in DC with a delegation from Los Angeles County and told them about that piece, Mike, and have emailed that to them. And so I've been trying to understand what it is you all are doing to achieve that 64% reduction, to achieve that 8,100 people housed under the CHIP program. And I've got to believe that it's no accident. I think you've built something here, and you've built something really extraordinary. If you'll indulge me, I'm gonna give a sports metaphor. I've had staff over the years who don't like my sports metaphors, but I don't care. I could go with baseball. I have spent many years in Boston, and I'm a Red Sox fan, but I've got a healthy fear of the Astros these days. I'm also a Nats season ticket holder for the last few years, and I've still got a healthy fear of the Astros these days. So I'm not going to give a baseball metaphor. I'm going to give a football metaphor because I'm from Tuscaloosa, Alabama, and we don't have a lot to hang on to in Alabama. So we do have Alabama football. And when I was in college there, Gene Stallings had come from Texas to be our football coach. He went to my church also. I sat in front of him every Sunday at church, and then I'd go to the games. We had a really good football team. We won a national championship when I was a senior in college in 1991. We were at the Superdome in New Orleans, just beating the crap out of Miami. It was fantastic. And then we were horrible for about 15 years after that. Coach Stallings retired. We struggled. We couldn't get back to that glory. Then we went and stole Nick Saban. And he built a machine, and Alabama's won about half of the national championships in the last 13 or 14 years. It is no accident. They built a machine around it. They get great talent. They might have a year where they don't do so well, but they're always right up there. But what they have built is a bar of excellence that is here. And the DNA, deeply rooted DNA of how you keep being successful, even when players graduate, even when assistant coaches move on. The parallel I want to make with you all is you've built that muscle. And I don't think it started in 2011. The success we see started in 2011. I think you were building those muscles well before that. When I hear about the durability of this coalition, and I know it's been through ups and downs, but since 1983, when I see the commitment of the faith community here, the business community here, the city and county aligned. Who does that? I mean, who does that? Where that many constituencies, the nonprofit community, the business community, city and county are focused on the shared goal, not focused on the finger pointing, not focused on what you're supposed to be doing that you're not. I could name drop Melody, who's been, I feel like I should have a bingo card every time somebody says Melody today. We need to reproduce the kind of alignment you all have around the country. Let me just say a quick word about what we're doing at the federal level. I stepped into this role running the U.S. Interagency Council on Homelessness about 8 weeks ago, and our team had already done extraordinary work on building the groundwork for a new federal strategic plan, which we'll be releasing later this year. The team held almost 100 listening sessions with people from all over the country, many of whom had experienced homelessness themselves. In that federal strategic plan, you are going to see a laser-like focus on racial equity, LGBTQ equity, gender equality, and protections for people with disabilities. I believe that it is no accident that people of color are overrepresented in the homeless population. For all of your successes here in Houston, your homeless population includes Black folks at a rate of 3 to 1 compared to the general population of Harris County. That is not okay. It's not an accident. It's not going to solve itself by accident. You got to bring a real racial equity focus to your work. We're also deeply committed to data and evidence. We are going to promote activities and best practices that are grounded in evidence, that are grounded in data. We're going to push the federal government to do a better job at cross-sector and cross-departmental data sharing. We're going to try to get beyond using only the PIT count and HMIS as our primary drivers of homelessness data around the country. And we're going to also put in place a national research agenda that builds the evidence base over time for what works. We are also going to go upstream and focus on prevention before homelessness ever happens. And I don't mean at the moment of eviction. I don't mean diversion at the moment somebody calls the coordinated entry system. I mean 6 months or a year or 5 years before that, where we're using the health system and the education system, the criminal justice system and the foster care system to determine who's most at risk of becoming homeless and intervene much earlier so that no young person ever exits foster care into homelessness, so that no one ever is discharged from a jail or a prison and ends up on the street or in the shelter. If we could turn off those two faucets at foster care transition and criminal justice reentry, we are also doing the work of racial justice because those two systems disproportionately target people of color. You've got to turn off the faucet. We're also going to focus on the crisis response. I am so impressed at the work you all are doing around encampments here. It is thoughtful, it's focused, it's time-bound, and it's tied to housing and services. It may not be perfect. It probably has a long way to go. Just because you clear one encampment doesn't mean another one may not pop up somewhere else. But the fact that you've effectively decommissioned more than 50 encampments in this community and connected people to housing and services is extraordinary. Keep up that work, finish it off. The focus on unsheltered homelessness has to be central to our homelessness response. We are also doubling down on housing first. The focus on housing and wraparound supports has to be the ultimate solution to homelessness. Housing is the basic foundation from which people can make all sorts of other good things happen, where you can attend to your health and behavioral health needs, where you can get a job and keep a job, where you can parent your children, where you can reconnect with friends and family and reintegrate in the community. Housing is the foundation. But housing first does not mean housing only. And you all know this. I think you've already been doing it. We've got to shore up the connections with the behavioral health system. We've got to shore up connections with the workforce development system and employers. We've got to shore up supports for families and youth and elderly folks. It is horrifying that people over 60 are the fastest growing segment of the homeless population. If we're failing our elders, what are we doing as a society? We've got to make sure that not only are we putting a roof over people's heads, but that we're wrapping a lot of services and support around them. So that's a preview of what's to come in the federal strategic plan, which you'll see later this summer. We're going to need you to implement. We can't implement at the federal level. We can set policy, we can shape directions, we can try to align the 19 federal agencies who are members of our council at the USICH, 19 federal agencies with 41 different funding streams supporting homeless programs. Our job is to align all of those and point it at the same direction. Your job is to implement it on the ground. Keep doing the work that you're doing. Many of you have had a chance to meet my colleague, Tamara Wright. She's our regional coordinator who oversees all of our work in Texas. If you don't know her already, get to know her. Let her be your point of contact. If you have any questions about what we're doing, she's a great contact for you. As we roll out the federal strategic plan, she's going to be a champion of that across Texas and a support for you in that work. We've celebrated a lot today. We've talked about the 64% reduction. I'll go back to Alabama football for a minute. There was a wide receiver when I was in college named Prince Wembley. He was never that great, but he would celebrate to high heaven every time you get a first down. Well, not even a touchdown. He'd catch a 12-yard pass and act like it was the end of the world. It was great. But we're not there yet. You know, it's good to celebrate. It's good to acknowledge the progress. But the reality is more than 3,000 of our brothers and sisters are still homeless in this community tonight. We are far from being done. And as much great work as you all have done over the last 11 years, 15, 20 years, the hard work lies ahead. And that's hard. It's hard when you're exhausted to hear that and to know that. You got to finish the work. You've got to double down on what's working. You've got to continue to bust through the barriers that are getting in your way. I hope you'll let us know how we can do that at the federal level. And you got to keep going until this is done. You are so close. You are so close to being able to say, you remember that time when we had homelessness in Houston? Remember those days? I hope 3 or 4 years from now, you're talking about homelessness in past tense, not in present tense. I was an outreach worker many years ago in Albuquerque, New Mexico, and my healthcare for the homeless program there had a really strong art component. We had art therapists with us on outreach doing art with kids in motels up and down Route 66. We had people doing art in our waiting room and in the art studio attached to our clinic. On the wall of my office today, I have a painting by a 5-year-old. It's this house. It's a good 5-year-old house, except it's got these sort of loops on the side of it. They kind of look like ears. And I said to him, Scotty, tell me about your painting. I learned that from art therapists, by the way. So tell me, what is that? He goes, it's a house with handles. It's a 5-year-old whose mom had fled domestic violence. When I met her, she had a fractured skull with black eyes like this. Her 10-year-old son was not only parenting his 5-year-old brother, but also looking out for his mom in the shelter. And Scotty painted this picture and he said, it's a house with handles so I can take it with us wherever we go. That painting grounds everything I do these days. And your work, the successes you see every day, the smile of someone who came into the dental clinic with front teeth missing and comes out with this gregarious smile. These stories ground us. These human relationships we have with one another drive us. And together, we can recommit to this work. We can double down on this work. We can keep doing what's working. We can lift each other up when we're feeling exhausted. And we can keep going until the work of homelessness is a thing of the past. Thank you so much for letting us be here today and for this week. You all have been incredible this week. Thank you very much.
Thank you so much, Jeff. So right now we are going to open the floor for questions and answers. My colleague Katina will be on that side of the room. I will be on this side, so that way we'll be able to pass the microphone. You are able to share your name and affiliation, but still please keep it a little brief so that way we can get through all of the questions and answers.
Hi, my name is Nakia Sims. So I'm on the local Houston COC steering committee as a person with lived expertise. So appreciative of the people that advocated to have people with lived expertise as well as your listening sessions. So my question stems from watching your Spark with Marc way back when. One of the things that you touched upon with the 6 steps was about the kind of the intersectionality of homelessness. And then when we talk about child welfare systems, and as an African-American woman with $122,000 in student loans, earning under living wages, part of those systemic racist barriers that one must face, what's the, I guess, the not being reactive, but being proactive when you talk about women, especially African-Americans who these touch systems, it's a different reaction. So I guess my question is so that African-American women specifically, our children don't have to be in foster care system. Our children don't have to be in the criminal justice system. What are some things federally that can be done, including voices of women like me with children, you know, to avoid the systemic racism and the cycle of homelessness and housing instability?
Thank you for the question, Nakia. And also thank you for the incredible work you all do to guide this system. I had a good conversation with Gregory yesterday. People who have been closest to these problems, people who've experienced homelessness themselves, have to be equal partners in this work. It can't be white executive directors and board members deciding on behalf of people of color experiencing homelessness. We've got to be in real power sharing and real solidarity in this work. So thank you for all of that. Around your question, you asked a big question, which is a real fundamental rethinking as a society about how we come to some sense of racial justice. The Spark project that Nakia talked about is a project that I was part of a number of years ago called Supporting Partnerships for Anti-Racist Communities. And we looked across the nation at the intersection of structural racism and homelessness. And through quantitative analysis of 161 individuals who'd gone through homelessness systems and 200 oral histories with people of color experiencing homelessness, we learned a lot. And one of the things we learned is that many people of color, and in particular young Black moms, if I can be just very direct about that, have so little economic buffer that if anything bad goes wrong, a car repair, a child gets sick and you can't go to work, anything, not only do you not have $300 for that car repair, nobody in your network does either. We started talking about this as network impoverishment, that a whole network of people has been kept out of the economic opportunities this country has had to offer. If you start tracing back the historical roots of that, you can tie it to redlining, you can tie it to a lot of other policies, but you know, my ancestors, my grandparents were able to buy into the housing market. They weren't rich, but they were my grandfather was a truck driver in Birmingham. They didn't have a lot of money, but they were able to buy into the housing market in the 30s and 40s when it was cheap, when there was a lot of government subsidy for it through Works Progress Administration and FDR New Deal programs, and then through GI Bill. Black people, Latino people, Native American people, Asian people were kept out of that possibility. Now, let somebody buy into the housing market in 1930, 1938 for $10,000, see what that home's worth now, pass that generational wealth on 2 or 3 times, and that white kid is less likely to come out with student loans, more likely to have an uncle they can call on if things go wrong, more likely to have equity in a home that they can draw on during a time of crisis. It is no accident. These are not individual decisions that people of color are making. This is generational wealth gap that has been developed over time. Now, your question, you told folks to be brief with their questions. You didn't tell me to be brief with my answers. I can't be. Let me wrap this up.
Have a few more minutes to answer it. I meant to mention that we may have some people streaming who may have questions coming through.
Okay, great. Let me answer quickly Nakia's question about the federal response. I am really impressed with Secretary Fudge at HUD right now. She's the chair of our council, so she's essentially my board chair these days. She's announced 2 things in recent days. One, around examining all of HUD's policy around criminal backgrounds being a barrier to housing. That's a good step. The other is that the White House and HUD have launched into a serious discussion about the racial gap in mortgages and appraisals. So these are sort of big picture policies that can happen. What we're doing in our federal plan is embedding racial equity as a principle, a pillar, and a set of actions and strategies that cut across the rest of the plan. Thank you for the question.
I have one specifically about the HUD's definition on chronic homelessness. And I know many of us here know that there are really two ways to meet that definition, one of which is very straightforward, being homeless continuously for a year. And the other one is like infamously difficult to prove, which is 4 instances totaling 12 months over the past 3 years, and specifically how it impacts people who have gone to prison for more than 90 days and how that'll create a gap in that. Is HUD realizing that that may need to be redefined, or whether the prison time counts as a gap or not, or whether those 4 instances, totaling 12 months over the past 3 years, is actually effective and useful in this?
It's a big question. It's a really good question. The whole table over there is high-fiving each other now. So I do not speak for HUD. Let me say that. We are an independent agency that works across the federal government with the White House, with HUD, and with others to try to align policy. What I can tell you is we are in conversations with HUD about that very thing. The first federal strategic plan to prevent and end homelessness came out in 2010. It was called Opening Doors. And what it did was really focus subpopulation by subpopulation. Let's go strong at chronic homelessness. Let's go strong at veteran homelessness. And then we can really start looking at youth and families. And I think at the time that was a really useful frame. I even look at the work you all have done in Houston. One thing I've heard the last couple of days is that the work you all did on veterans was an extraordinary launch pad. It was a way of galvanizing public will, showing a proof of concept. Tamara was here when Houston essentially, effectively ended veteran homelessness. We know that some veterans still become homeless, but you all achieved a kind of functional zero. So that was useful. I think at this point, we need to rethink that subpopulation by subpopulation framework. The categories don't hold up. If you look at what is a family, if you see a single woman on the street or in the shelter, but her kids are with grandma, is she a family? Is she a single? If somebody's a veteran but doesn't have an honorable discharge, what do they qualify for? SSVF, but not this. I know VASH has expanded its eligibility. The categories are weird, right? The chronic homeless definition may be the weirdest of all. It feels arbitrary. Why are you more vulnerable at 12 and a half months than you were at 11 and a half months, or after 4 episodes of homelessness and not 3? So we are engaged in conversation with HUD and with other departments to kind of rethink and reframe all of this. I told you I've been on the job 8 weeks, so that's as far as we've gotten so far.
Okay. We may have like 1 minute for one more question. Okay.
You probably don't need the mic. Yeah.
There are people online though. Maybe, yeah, let's use the mic just so people online might hear.
So along with that chronic definition, is there thought or are there partners included to add to the narrative related to domestic violence? Because it gets carved out of that definition.
Right. The question was about domestic violence in the mix on this, how around chronic, but I think generally the domestic violence question is a big one. And we're certainly in very good conversation with folks at Department of Justice, as well as HUD, on how do we both recognize and continue to respond better to domestic violence. So that's kind of a broad answer to your very specific question, but certainly we're keenly aware of the dramatic overlap between family homelessness and domestic violence. At the local level, I mean, I was impressed, Barbie, that you are on this panel, first of all, and that you're as involved as you are in the work of the coalition. That's not true in every community. Sometimes there's a real divide between the domestic violence response system and the homelessness response system. So at the federal level, what we're trying to do is make sure we're connecting all the dots, which is our mandate as an agency. At the local level, I hope you'll keep doing exactly what you're doing, of bridging. Not everyone who experiences domestic violence becomes homeless. It's often very economically driven. Not everyone who's homeless has experienced domestic violence, but there's a ton of overlap. It's this kind of Venn diagram with a whole bunch in the middle. Keep holding that Venn diagram together in your response.
I have a question from online. Laura Cantor of the Montrose Center asks, we seem to be stuck on how we make sure we identify and address the unique needs of LGBT plus people. What is the best practice in this regard, and what do you recommend we do?
So yeah, I mentioned earlier our pillar on equity. There's a very strong focus on LGBTQ populations. I think there are a number of factors that go into this. One, so many young people who become homeless identify as LGBTQ. Let's make sure they're getting the support they need. Many have been rejected by friends and family and faith communities and are really on their own and are at incredible risk on the street, risk of violence, risk of exploitation. So to Laura's question, I think really shoring up our youth homelessness response. I know you all are a recent YHDP grantee, the Youth Homelessness Demonstration Project. Congratulations on that. It's a fantastic program. You're entering into a brave new world there. Around trans people, let's create shelters where they're safe, where people who identify as non-binary or who identify at different places on the gender identity spectrum have a place to be, where they've got safe bathrooms and showers, where they've got choice in what kind of a room they stay in and aren't told where to go based on their assigned gender at birth. Let's get a little 21st century about our response to transgender issues. Is that okay to say in Texas? I don't know if that's
yes.
But and then on the housing discrimination side, I think LGBTQ people still face tremendous discrimination around fair housing, and we need to do a better job at the federal level, making sure that HUD's Fair Housing Office is tied into our homelessness response. And at the local level, you need to make sure that you're getting connected with your fair housing offices and advocates to jump quickly on discrimination, not just against LGBTQ people, but against all protected classes. Let's connect the dots between fair housing and homelessness.
Awesome. Did we have any more questions online? Okay.
It's more of a challenging question. Mr. Olivet, again, it's a pleasure, and to all the individuals here and the great leaders and CEOs and people that are so committed to the purpose of helping those of us such as myself. Excuse me for sitting down. I got a bad back and everything. But my question to you is, and I'm going to speak this into existence, the next time that you'll be here, I would challenge each of you and every one of you to do a town hall, and each person here that is here today has to bring a lived experience person with them.
Gregory, thank you. Challenge not only accepted, but embraced. Let's do that.
Thank you so much. Thank you so much.
It's great to be with you all. Thank you.
Thank you. We have had a pleasure hearing from Jeff Olivet. We appreciate you for being here with us, Jeff. We cannot thank you enough, and for answering the questions and everything. So yes. Really quickly, I would just like to acknowledge Council Member Sally Alcon and Council Member Amy Peck, who are steadfast advocates for our system, housing, and solving homelessness. So major thank you, Council members. Thank you. And here we go. So no, I know this is not quite on the agenda. Coalition, don't freak out, we're okay. But I noticed that there were a few people that left their names off of here, and I just want to give a major shout out and thank you to Sarah Martinez, VP of our Communication and Development team. Catherine Villarreal, Director of Communications, and Katina Mien, Director of Development, for even coordinating this and putting this all together. This was an outstanding event. Thank you, thank you, thank you. So now as we go into our final presentations for the day, we are going to hear from some of my colleagues at Coalition for the Homeless. Now, something that I have learned over my lifetime, and especially during COVID, is to give people their flowers while they're here. So I am so excited to be able to introduce this woman who gave me a chance to be at the Coalition for the Homeless, who trusted me to manage the landlord engagement team. Shout out landlord engagement. Hey y'all. I cannot thank her enough, and I am indebted to her. So I am so excited to be able to bring up Anna Rausch. She is our vice president. She is our vice president of program operations, and she will be telling us about the community COVID housing program, which we also call CHIP. Unfortunately, Jessica Preheim, who is our vice president of strategic planning, is unable to be here today, but major thank you to her. And then we will also hear from my awesome director, James Gonzalez, who is the director of programs. Program operations, and then also another amazing director, Jonathan Danforth, who is the director of outreach and coordinated access, about our work and to decommission encampments in our community. So major thank you, major thank you, and please welcome Anna Rausch.
So I don't like to recruit from other organizations. I don't do that. However, I did recruit Ashlie. Sorry, Avenue 360. After the great work she did with Harvey, she was just amazing, and I knew she was the right person for the job. So, all right, so I'm here to talk about CHIP. So I'm gonna go back a little bit and let's think about, oh wait, let me get my clicker. Hold on, let's make sure this works. All right. So let's all think back to what we were doing in March of 2020. Many of us were on spring break, including myself, and I was at my favorite place in the world, which is, thank you. Look at that. All of you know me. I was at Disney, yes. In fact, I was there when they closed the resort on March 16th, 2020, only the 6th time ever in its history that the resort had been closed, and I had now been there for 2 of those times. So that's a story for a margarita day or something. So we'll talk about that later. So when I got home, the coalition had made the decision to have staff work from home. And so every day, you know, we were working on Zoom, we were learning about Zoom, GoToMeeting and all that. And I was in different rooms of my house, my desk, chairs outside, enjoying the beautiful spring weather in Texas. And my back started hurting because I wasn't prepared to work from home. I don't really have a home office. And so I was thinking, this is gonna blow over. I'm an optimistic person, you know, glass half full. This is gonna blow over. I'm sure a lot of people were thinking that. And then my back really started hurting. And I finally had to go to the office to get my double monitors, my desk and my chair so that I could properly work from home, wearing a mask for the first time, and we were on full lockdown. So the coalition had made the decision to jump into full disaster mode. So here's our wonderful Scott Moore, who along with, yes, along with many people in our organization, took turns at the office to help respond to the pandemic. Out to our partners immediately to make sure that they were able to continue to serve people experiencing homelessness, even while we were responding to the pandemic. We set up so many work groups. I think we had like 6 work groups. It was for the unsheltered, emergency shelter, permanent housing, communications, food and basic needs. We've coordinated distribution of over 24,000 meals, tens of thousands of PPE equipment that was donated to us from very generous sponsors. In partnership with and with funding from the City of Houston and Harris County, we stood up an isolation and quarantine facility where people experiencing homelessness could wait for test results and recover from COVID. Within 3 weeks of the pandemic's arrival, we worked in partnership with Healthcare for the Homeless Houston and the mayor's office to help implement a dedicated COVID testing system for people experiencing homelessness. We worked with the Salvation Army of Greater Houston and with funding from the City of Houston and Harris County to set up an auxiliary emergency shelter that allowed for social distancing and decompressing of our shelters. And we worked with partnerships from City of Houston and Harris County to set up 16 hand washing stations at hotspots throughout unincorporated Harris County so that people experiencing unsheltered homelessness could, keep clean and wash hands and all that. We were meeting weekly with all of our city and county funders. Jess, Sarah, and I even set up weekly therapy sessions with our brother Marc, so we could keep in communication with what was going on at the mayor's office. And then, of course, the Coronavirus Aid, Relief, and Economic Security Act was signed into law on March 27, 2020. The CARES Act funding was intended to be a public health tool to enable cities to respond to both the economic and public health risks of COVID. Right away, we realized that we had to apply some lessons learned from 2009 from the HPRP program from that recession response where we developed our existing rapid rehousing program. So the CARES appropriation through HUD was specifically intended to be used as a public health tool to rehouse the homeless, permanently decompressing shelters and thus reducing the risk of ongoing community spread. Immediately, the idea started flowing on how we could use COVID relief dollars for permanent housing. The city and county reached out to the coalition to ask for help in determining how these funds could be best put to use. We were already at the end of a comprehensive 5-year strategic planning process, so we knew where some of these gaps were. We knew where we needed to put our resources. Jessica Preheim, my partner in crime, couldn't be here today, but she and I met and talked and argued and talked and argued some more. We had numerous internal meetings. We talked amongst ourselves, reached out to a lot of our friends that had worked in our community and were experts in the field on what we could do. And then, of course, we put a crazy spreadsheet together because we love our crazy spreadsheets, and what's a crazy idea without a crazy spreadsheet? And then when I first told my team about this crazy idea, they looked at me like I was crazy, which sometimes I felt like I was. And they were like, "Are y'all crazy? There's no way we can do this. We need more staff. No partner is gonna wanna do this." But the more the stubborn Brazilian hear things like that, the more I wanna do it. So they know not to say no, because I'm just gonna wanna do it. And so out of this, the Community COVID Housing Program, which we call CHIP, was born. I remember endlessly scribbling down acronyms. We love acronyms. And we were scribbling down acronyms on pieces of paper and sending them to each other in teams and laughing about it. And we finally agreed on CHIP, like you're eating a potato chip. There was nothing more to it. And then we pressed on. We got asked why over and over, and we had to explain ourselves over and over. We really knew that this was an unprecedented opportunity, the most effective public health response to reduce the community spread of COVID-19 amongst people experiencing homelessness was to ensure that all people experiencing homelessness had a permanent home. Rapidly expanding access, to housing would improve healthcare outcomes and reduce reliance on expensive emergency services like hospital visits, thus decreasing the burden on the healthcare system and reducing costs. And then, of course, used wisely, CARES Act funding would allow us to transform the homeless response system and get ahead of future demand for crisis housing due to the economic impact of the pandemic. So then on July 1st, the city of Houston, Harris County, the coalition jointly announced CHIP. The county portion of the funding got a unanimous vote at Commissioner's Court, which was amazing. The goal of CHIP was to accelerate the work of the way home by targeting approximately 5,000 people over the next 2 years, because for people experiencing homelessness, housing is healthcare. They really needed a place of their own in which they could be safe and isolate. CHIP consisted of several strategies that you see here. The Bridge to Permanent Supportive Housing, which was acceleration of people that were experiencing chronic homelessness, living unsheltered in encampments, would be housed immediately while they wait on a permanent supportive housing slot. Rapid rehousing was going to target 1,700 individuals for short-term 12 months of light services and rental assistance so they can get back on their feet. We had diversion to help approximately 2,000 people maintain or regain housing so that they do not have to enter emergency shelter. We had auxiliary social distancing, emergency shelter support, mental health case management for those that we were housing, enhanced street outreach in unincorporated Harris, Fort Bend, and Montgomery counties, and where we actually wrote the book on encampment decommissioning. And finally, we had housing preservation. The funding amount needed for CHIP was $65 million and came from several sources, with the City of Houston committing $40 million, Harris County committing $18 million, and the Coalition for the Homeless committing to fundraise for the remainder, or for what government funds could not cover. Some of these things were landlord incentive fees or basic needs, things that people could use to remain safe and stable in housing. After the procurement process, CHIP kicked off on October 1st, 2020. The goal to serve 5,000 individuals in 2 years was actually met prior to the first year anniversary of CHIP. To date, we have served 8,580 people. So yes, clap, that's great. These are some of the wonderful faces smiling and happy because they're going into their permanent homes. The success of CHIP led to the creation of CHIP Phase 2 to continue our rehousing efforts by serving an additional 7,000 people through the end of 2024, and an invitation to join President Biden's House America initiative. CHIP also led to being able to house more than 25,000 people since 2012, and a 64% decrease in homelessness since 2011. So this is fantastic. So here's the collaboration that several of you have mentioned so far. I do believe that this is a very powerful word. I get asked a lot, what makes Houston so different? And this is the word that comes to mind every single time. It is so hard to describe how everyone is always willing to help and to jump in for one crazy idea after another. When Jess and we spent the entire month of May of 2020 reaching out to many of you and doing presentations on CHIP and explaining it, and we were met with enthusiasm the entire time. We never once did we, have to go. 5 minutes, okay. And so our COC is amazing in that we always support and look after one another. It's important to remember, and I want everyone to remember this, that CHIP was intended to accelerate the existing homeless response system. That means that CHIP agencies would be housed alongside current partners who are continuing to house people during the pandemic. Even while we were onboarding new projects and everyone was training, our existing partners were continuing their hard work. Some of these partners also expanded to participate in CHIP. This is the spirit of collaboration that's hard to describe into words. At the end of the day, we are the way home, working together to keep more than 8,000 people housed and continuing to house new people every day. Thank you to all of you.
Oh, yes. Now we will have James Gonzalez. Hi, Director.
Hi, everyone. Oh, hey, Kelly. Okay, so let's see here. Oh, no. Anna, you said it worked. There it goes. Okay, great. All right. Hi, everyone. I'm James. I'm going to be talking about encampments. Okay, so CHIP gave us an incredible opportunity to confirm that people living in encampments want a safe place to call home. Like Anna said, we get asked all the time, why is Houston's encampment response so successful? And we tell them, we use housing. Currently, 255 individuals have been placed in housing or are well on their way to. Like Anna mentioned, in the beginning of the pandemic, it was very important to isolate to prevent the spread of COVID-19. People in encampments are not given that luxury. And many businesses, agencies had to roll back their hours. And so they were missing out on some of the basic needs that they were used to getting met. As it's also been mentioned several times today, I don't know why I thought I'd be the only person with a slide saying this. We are extremely lucky to have the city and county wanting a holistic approach to encampments. Without their political support and financial investment, this would not be possible. Okay, so we've been here quite a while, so we don't want to get into the dirty details of how we plan an encampment decommissioning, but we did want to give you a brief overview. We pick an area, map it out, talk to everybody, make a client list, learn about all the quirks because every location is different. They all have something, some kind of secret mystery that's just waiting to be untapped. And based on all that information, we figure out what resources we need to close that encampment. You can't see all the text there, but I know what it says. So, whenever we talk about encampments, everyone automatically thinks about the outreach team, and many of them are sitting over there, and they're wonderful. But I have to mention that these decommissionings would not be possible without our housing and landlord engagement team. There's one there, there's a few over there. Some of them better be watching. They were supposed to be logged in, So without them working behind the scenes, these clients would not be paired to the appropriate housing intervention. Many of them would have gotten on the wrong bus to the wrong apartment complex. And there would not be units to match the specific need that many of our clients have. Like if you have a beloved pit bull and no one wants to take that pit bull, you got to find a place. So we talk about, we collaborate, we pull together resources, and there's just encampment magic and it all gets solved, but it's hard to really visualize that. So I put together an example for you. Last year, we decommissioned an encampment near Allen Parkway. To give you kind of a rough idea of what it was, we went in there, guns ablazing, no, it was much more relaxed than that. We made a client list, surveyed the area, saw if there were any safety precautions we need to keep in mind. We did client housing assessments, collect documents over several weeks, and then over the span of 1 week, we decommissioned that area. At the end of that week, there were 47 individuals housed, 3 self-resolved, and 3 refused. Here's a before and after picture for you. One of the things that I'm always reminded by about this encampment, and like I mentioned, they're all different. There were actually several people who were employed living in this encampment. I think a lot of people assume that people living in encampments or unsheltered do not work or do not try to increase their income, and that is not always the case. So we were chugging along, housing people left and right, feeling good, and then the rental market shifted out from underneath us, and we had to come up with a brand new plan. As was also mentioned several times today, Houston, the tough get going, and we just figure out something else. So we're very fortunate that the city decided to fund a temporary and permanent navigation center. The Navigation Center, I should probably tell you what that is if you don't know, is a safe temporary place to stay while you are waiting for your housing to be finalized. Right now, we're using the temporary center to continue our encampment work, and the permanent location we expect to be ready later this year. And with that, I'm going to hand it over to Jonathan.
I know everybody says the same thing, but I'm not sure which one is down. So I'm gonna test it out here. Okay. Thank you, James. Before I jump in, this is kind of my transition slide, but I want everybody to take a look at the map here. We have some local data about where encampments actually are in our community. These are the encampments that our outreach teams have gone out to find and have reported back across Harris County. And this gives a pretty realistic sense of the scope of what we're even talking about. And you can tell it goes really like to the edges of Harris County. This is a really large area. And I said thanks to James already, but I have to say it again because I joined the coalition just in January and everything was already done. We were in the news. We had a national best practice. So we are leading the country on closing encampments. And we had a temporary navigation center. So we had a place for all these folks that we were working with to go. My job was kind of just to don't screw it up. And it wasn't really a surprise that we had done all these things, because the strategy in Houston for the city and for our homeless response system, since I arrived in Houston, back in Houston, 6 years ago, working at Search, it's been, let's get folks off the streets into housing. Housing informs everything that we do. But yet, in the last few months that I've been here, I keep getting the same question about how do we have an effective response to encampments? And the equation is actually pretty simple. The effective answer is the same as the compassionate answer. And that was a plug I got from Marc Eichenbaum, so thank you, Marc. But it's true that housing people permanently is the compassionate response, but it's also the response that works. And the way that we know that in encampments is that if we're not putting people into housing, what happens? Well, if people are having to leave an encampment, they're just going to be displaced. And I can't really think of a less effective response strategy than one where people just move around and go somewhere else and don't actually get their needs met and cycle through these systems that we've been talking about today. So to give a sense about some of the impact that we've had, I just wanted to show you guys how we define encampments real fast. This comes straight from the national best practice. We have large, small, and hotspot encampments. And when we're talking about our results, that's kind of how we categorize them. So I'm going to just quickly go through the encampments that we've decommissioned. I'm not going to read it off, you guys can just take a look. But you might recognize some of these streets. These are places in our community where all of us live. And what you may have noticed in the last several months, or actually over a year now, is that the encampments in these areas have disappeared. And if you've noticed an encampment near you that's disappeared, it's probably here on this list because it's probably part of this project that we're really seeing change our community. To bring it down to earth so that we can kind of get a sense of what this means for the people that we're working with, I wanted to talk about the encampment we decommissioned last week. The Spur in Midtown is an encampment that I did outreach at years ago when I started doing outreach here in Houston with Search. And it had actually some of the same people living there that I knew when I started over 6 years ago. The incredible thing when you go into an encampment is you really have to consider what the community's culture is. You think about different neighborhoods. Some neighborhoods have an HOA and everybody votes and likes each other and gets along, I think. And then some are the exact opposite. And this encampment had a community that was really based around supporting each other. We saw 100% of the folks from this encampment actually move together to go to the temporary navigation center to get housing. And one of the unique features of this group was that there were actually 3 folks living there for a very long time who were hearing impaired. And so this group needed to stay together because they found their purpose in the support that they offered each other. And I don't think that this group would have been able to pursue housing any other way. And I say that because I tried, 6 years ago at Search. The cool thing about all of this is that it's actually happening all over the map. The green sections on the map here are the areas that we decommissioned already. And so those are the areas, again, that we all live in. And so you may wonder, what does this mean for me when I drive by? The tents are gone. Other people may show up, we know that, but we have partnerships with law enforcement where they understand what we've done and they're on board with connecting folks to services to keep that work going. And I know I'm out of time, but I would be remorseful if I didn't acknowledge all our partners. Our nonprofit partners, our service providers, our team that's here today, they make this work. Our public partners, the city, the county, the state, we're coordinating with folks every day to scale up and make this possible. And we've got it down to a well-oiled machine where every week we're getting updates about new encampments, about housing inventory. We're meeting with all our public and nonprofit providers to find out what can we get done this week. And we're to the point where we can decommission multiple encampments at a time. So the hope is in the future that we continue to build capacity, we continue to expand this work, hear the voices from the people on the front lines, the partners doing the work, and that we, I'm out of time, sorry guys. that we keep it going. Thank you.
No, I'm super excited to once again bring our CEO, Mike Nichols, back to the stage so he can speak. Just a quick thing, thanks. Just a quick thing, we were just asking that if you're partners of the way home, if you could come to the stage immediately after so we could take a picture. Thank you. So none other than Mike Nichols to close us out. Thank you.
So Jonathan Danforth described his job when he came to the coalition, and I would say he described my job today and maybe every day as I lead the amazing team at the coalition. And as Jonathan said, our job is just not to screw it up. I want to thank our sponsors, Court Furniture, the Valak family, Zillow, Life Essentials, Houston Methodist, Group 1 Automotive, and Amity Bank. I'd like all the presenters to stand up so we can clap one time to thank them. I want to thank Jeff Olivet and Tamara Wright for not only the keynote address, but for staying in Houston these last couple of days and sharing ideas with us and hopefully bringing them back to Washington. I want to say again, thank you to our small but mighty communication and development team, Katina, Sarah, Kathy Villarreal, and our newest employee, and I'm drawing a blank, Allison, thank you. I want a special thank you for the amazing, amazing Ashlie Young. Ashlie, you have to come up because Sarah's going to hand you some flowers.
I did this for the love of the coalition. Everything that we putting together.
Well, Ashlie, the goal, but the goal for today is to give everyone in this room and everyone with whom we work the additional energy and additional knowledge to overcome the many, many barriers and problems that we face every day in getting our jobs done at the homeless response system. It is a lot of work. I'll leave you with 3 thoughts and 1 prayer. The 3 thoughts is we need to continue to double down on housing with support services. We need to double down on building funding with fewer barriers and longer terms. We need to double down on collaboration and all that that means. And my prayer is from the Jewish Book of Wisdom of our mothers and fathers, the Pirkei Avot. And it's that all of us doing this work and all of those who we serve recognize, first, overcome any discouragement that they feel every day, which I know you feel, and you overcome it. And that we recognize, and this is from the Jewish Book of Wisdom, it is not our responsibility to finish the work, but neither are we free to desist from doing it. So thank you very much, and thank you for your efforts today and every day. Thanks so much. So the COC folks, partners.
So if our partners can come to the stage so we can take a picture, that'll be great. Thank y'all so much for joining us for State of Homelessness.
really fast. Can you thank our consumer representatives for coming on? Test it.
I had one other thank you as you're getting, I had one other thank you that's on my list. I had one other thank you that's on my list. I've got one other thank you I missed, and I apologize. I want to thank our consumer representatives from coming on. I want to thank our consumer representatives for coming here and presenting and helping us be part of this great day.
And if we could have all partners of the way home come to the stage for a picture. If you're a partner of the way home, if you consider yourself a partner of the way home, please come to the stage so we can take a group picture.
She hit them with the 10-cent pistol because they're on the lane. Well, she hit them with a 10-cent pistol and they never been the same.
The way home. Calling members of the way home for a picture. If you work for an agency, that's part of the way home. If you work for a government partner, that's part of the way home. If you work for the coalition, come to the stage. Everybody, partners of the way home. One big happy family.